This is Audible.
Borderline personality disorder. The hidden faces of BPD that you need to spot. How to manage out-of-control emotions before they destroy your relationship. Written by David Lawson, Ph.D. Narrated by Russell Newton. Introduction. As with many other mental illnesses, there's plenty of stigma attached to borderline personality disorder, or BPD. Thanks to stereotypical portrayals of mental illnesses in film and television, many people view those suffering from disorders like BPD as being wild, uncontrollable, and weak. If you or a loved one has been diagnosed with BPD, it can present a number of challenges. Thanks to these damaging stigmas, people suffering from mental illness often have to contend not only with their disorder, but with the stereotypes and discriminations of others. Common preconceptions surrounding BPD include the belief that sufferers are always overly dramatic, manipulative, and attention-seeking. While these traits can appear in sufferers of BPD, the truth is far more complex. In this book, we'll take a look at the realities of borderline personality disorder, analyzing exactly what the illness is and the types of behaviors it can lead to. In Part 1, we will look closely at both the overt and more subtle symptoms associated with BPD to assist you in determining whether you or a loved one may be afflicted. We will also examine the underlying causes of the disorder and the different forms of BPD can take. Methods of diagnosis will also be discussed. So, what if you have been diagnosed with BPD? Does this mean you no longer have the potential to live a normal and fulfilling life? Does it mean you have to conform to the stereotypes of being unstable, angry, and helpless? Of course not. With the right tools and treatment, BPD can be managed effectively, allowing you to have a rewarding career, close friendships, and meaningful relationships. In Part 2, we will look at the many tools you can employ to keep the disorder under control. We'll take a look at effective methods for handling unpredictable emotions, along with specific therapies often used in managing the disorder. Of course, relating to your loved ones can be a huge challenge when faced with BPD. Thanks to the violent mood swings and unpredictable behavior associated with BPD, it is likely you will fear unintentionally hurting those you care about. In order to manage this, we will take a look at the things it's important for your loved ones to know in order to help you cope with BPD. Our guide will help you explain your illness to your family, friends, and partner, helping them to understand and empathize with what you are experiencing. Following these guidelines will assist you in creating a secure and loving support network, making the disorder more manageable. As we have touched on, borderline personality disorder can be just as difficult for loved ones as it can be for the sufferer themselves. Perhaps your family member, child, parent, or partner has been diagnosed with BPD, and you're struggling to know how to react. Perhaps that's why you picked up this book. In Part 3, we will take a close look at how to cope when those close to you are suffering from this disorder. We will examine how to speak to those with BPD in order to avoid conflict, and ways to manage being in a relationship with a BPD sufferer. As people with BPD can often be manipulative or emotionally aggressive, it can be just as important to take care of yourself in such situations. We will look closely at ways to disarm those who are attempting to manipulate you in order to facilitate a harmonious relationship for both parties. And if you decide that for whatever reason the relationship has no future, we will address ways of breaking up with a BPD sufferer in order to produce the minimum amount of conflict and distress. Living with BPD does not have to be a life sentence. Following the advice provided will help both BPD sufferers and their loved ones have a happy and fulfilling life. Part 1. Understanding Borderline Personality Disorder. Chapter 1. What is borderline personality disorder? Borderline personality disorder, or BPD, is a pattern of mental behavior that causes sufferers to have difficulty controlling their emotions and impulses. Thanks to their often aggressive and unpredictable behavior, with BPD will often experience many unstable relationships in all aspects of their lives. BPD causes sufferers to feel uncomfortable in themselves and exhibit strong emotional reactions to seemingly routine events and circumstances. They live through a pattern of extreme emotional highs and lows. Borderline personality is so named as people suffering from the disorder were originally believed to be on the borderline between psychosis, difficulties determining what is real, and neurosis, a mild mental illness largely characterized by depression, anxiety. People with BPD often experience high levels of anger and distress and take offense easily. Sufferers struggle with a low sense of self-esteem, having regular painful thoughts about themselves and others. Unsurprisingly, this often leads to ongoing problems in their family and social life. This low sense of self-worth and regular stream of negative thoughts can lead to self-harming and, in severe cases, suicide. Many people with BPD live their lives with an ongoing pattern of unstable social relationships. They're prone to developing intense, almost obsessive attachments to others, which can change almost without warning to feelings of intense anger and dislike for the same person. This fluctuation from extreme to another is highly indicative of borderline personality disorder. BPD appears in approximately 2% of the general population, with women 3 times more likely to suffer from the disorder than men. BPD usually appears during the teen years, with symptoms gradually improving as sufferers go through life. The causes of BPD are unclear, but can be traced to environmental, social, neurological, and genetic factors. BPD can also be sparked by difficult life events, such as childhood trauma. Many experts believe the illness is brought about by a combination of factors, such as genetic and environmental. Drug and alcohol abuse, depression, and eating disorders are all commonly associated with borderline personality disorder. Sufferers of BPD often experience other mental illnesses in conjunction with the disorder, such as depression, post-traumatic stress disorder, or bipolar disorder. Thanks to the plethora of other illnesses that can coexist alongside borderline personality disorder, BPD can often be difficult to identify and diagnose. While borderline personality disorder has immense destructive power for both sufferers and their loved ones, the good news is it is treatable. In Part 2 of this book, we will address numerous ways BPD can be treated and managed, allowing sufferers and their loved ones to live their lives to the fullest with minimal degrees of stress and conflict. Chapter 2. The Traits of Borderline Personality Disorder. As mentioned in the previous chapter, people with borderline personality disorder often also suffer from other mental illnesses, including issues with anxiety, eating disorders, and substance addiction. BPD has many symptoms in common with illnesses such as bipolar disorder, often making it difficult to distinguish and diagnose. Let's take a look at some of the most common symptoms and traits associated with BPD. Difficulty regulating emotions. Perhaps the most recognizable trait of borderline personality disorder is the sufferer's inability to regulate and control their emotions. People with BPD will often act out in ways that may seem out of proportion to the situation or seemingly unprovoked. Intense emotions. People with BPD will often react to a situation or event in a way that seems disproportionate to what is happening. They're prone to rapid and violent mood swings and can fluctuate between states of intense happiness to crushing depression in very short spaces of time. Sufferers of BPD describe the disorder as an emotional roller coaster. Heightened sensitivity to criticism. People suffering from borderline personality disorder are prone to taking criticism very badly, often taking offense and acting out in response to even the smallest piece of disapproval. Identity disturbance and distorted sense of self-image. People who suffer from BPD often have trouble making sense of their own identity. They often find it difficult to pinpoint their likes and dislikes, passions, beliefs, and values. They're often unsure about their long-term goals, particularly with regards to employment or relationships. As a result, people with BPD often feel lost or empty with little sense of direction. BPD can also cause one's self-image to rapidly fluctuate between healthy and unhealthy. Manic efforts to avoid abandonment. Perhaps the thing that BPD sufferers fear the most is abandonment. This is often due to the trauma they experienced as a child, which led to the condition. More on this in Chapter 5. People with BPD want and need human connection, but they fear their friends and loved ones will leave them the minute they get angry or frustrated. In an attempt to avoid abandonment, BPD sufferers will often go to extremes to avoid being abandoned, such as ending a relationship or friendship at the first sign of trouble. In this way, they avoid abandonment by being the ones to end the relationship. Black and white thinking. Also known as splitting or all or nothing thinking, black and white thinking refers to an inability to reconcile oneself with both the positive and negative aspects of a situation or person. People who think in such a way will generally see a situation as either all good or all bad with no middle ground. In BPD, sufferers have a tendency to focus on the negative side of events, their bad representation dominating the good representation. For example, a person suffering from BPD may see love and sexuality as lewd and perverse, rather than acknowledging the tender qualities of such relationships. In the same way that a person with a black and white thinking may see another person or situation as all good or all bad, they will do the same for themselves, seeing themselves as either flawless or inherently bad. While most people have the ability to acknowledge that two contradictory states can exist at once, i.e., no one is either all good or all bad, people with BPD are unable to accept the ambivalence of this. Instead, they shift rapidly from one extreme to the other in order to accommodate their fluctuating emotions. If they are in a bad state and focusing on a person's negative qualities, they have no awareness of the same person's positive traits. Reckless and impulsive behavior. Sufferers of BPD are likely to engage in damaging behaviors such as impulse buying, binge eating, unsafe sex, drug and alcohol abuse, and reckless driving. While impulsive behavior is not in and of itself necessarily a symptom of BPD, It is the difficulties BPD sufferers face in controlling their impulses that lead to impulsive and reckless behavior. Often, sufferers of BPD engage in reckless behavior in an attempt to either calm the emotional storm inside them or to wake them from a sense of emptiness and detachment. But this impulsive behavior may not always take the form of something that appears to be damaging. The impulsiveness of borderline personality disorder can also lead sufferers to engage in behaviors such as oversharing emotions, quitting their job unexpectedly, joining and then quitting different groups or hobbies, clearing out all their belongings in an attempt to start again, abruptly canceling or changing plans, unstable personal relationships. Thanks to both their difficulties controlling their emotions and their deep-seated fear of abandonment, BPD sufferers will often find themselves in a string of damaging and chaotic personal relationships. We will explore relationships and borderline personality disorder in details in parts 2 and 3. Self-damaging behavior. Often used as a coping mechanism against overwhelm, BPD sufferers are prone to self-harming, both physically and emotionally. Examples of this may be sabotaging their own work at school or in employment, rather than facing the stress associated with meeting deadlines, or engaging in alienating behavior in order to drive others away. Often, sufferers of BPD will engage in these types of behaviors in order to gain a little relief from their emotional pain. Of course, this relief is almost always short-lasting and can result in guilt and shame. This leads to a cycle in which the sufferer then turns to destructive behavior in an attempt to relieve the guilt. As time progresses, self-damaging behavior can become an instinctive and unconscious response to emotional pain. More obvious forms of self-destructive behavior, such as eating disorders, substance abuse, self-injury, and sex addiction, are also associated with BPD. It is estimated that at least 10% of BPD sufferers will attempt suicide throughout their lives. Disassociation. Zoning out, or feeling as though they're not in the real world, is a common trait for people suffering from BPD. Disassociation refers to a disconnect between a person's thoughts, emotions, behaviors, memories, and identity. Disassociation is a common coping mechanism for people with BPD, along with a number of other mental health disorders, such as PTSD and acute stress disorder, both of which can coexist alongside BPD. Disassociation can be broken down into several facets. Depersonalization. A person experiencing disassociation often feels a sense of disconnect between themselves and their body. It's akin to watching yourself within a dream or from outside your body. Derealization. A similar experience to depersonalization, derealization is a sense of being separate from the world around you, including other people and the objects around you. If you experience derealization, the world around you can feel unfamiliar and strange. Amnesia. Disassociation can lead to short periods of amnesia, or lost time, in which the sufferer cannot remember what they were doing at a particular time in the day. Identity confusion. The feeling of being attached from yourself and the world can lead sufferers of disassociation to question who they are. Identity alteration. Identity alteration is the act of behaving differently as brought about by your circumstances. For example, not recognizing the world around you due to disassociation. While all of us experience identity alteration from time to time, behaving differently in unusual circumstances, it is a common trait of sufferers of BPD. Some BPD sufferers have reported struggling so much with their identity and knowing who they are, they have changed their name multiple times by deed poll. Knowing these common symptoms can help you if you believe you or a loved one may be experiencing borderline personality disorder. However, there are a number of hidden signs of BPD that are not so overt. In the following chapter, we'll take a look at some of the more subtle symptoms of borderline personality and how to spot them. Chapter 3. The Hidden Signs of Borderline Personality Disorder. While many of the symptoms of borderline personality disorder are difficult to miss, there are also traits of the illness that are much more subtle. A person exhibiting these more subtle signs is said to be experiencing quiet borderline personality disorder. Whereas people with BPD often experience violent mood swings, which are easy to recognize, those with quiet BPD are more likely to internalize their feelings. While they still experience the same fluctuation of emotions, the disorder can be much more difficult to spot. To recognize quiet BPD in either yourself or a loved one, look out for the following traits and symptoms. Struggling to maintain relationships. People with quiet BPD may speak about how they find it hard to keep relationships, whether romantic or otherwise. These relationships will often have been ended by the other person, unable to cope with the BPD sufferer's wild mood swings and aggression. However, as mentioned in Chapter 1, it is also common for people with BPD to preemptively end a relationship they feel is struggling, as they so often fear being abandoned. Low self-esteem. While quiet sufferers of BPD may be less prone to self-damaging behavior, such as reckless driving or violence, they are still likely to suffer from a severely diminished sense of self-worth. Often, this will only be noticeable to others by paying attention to the way they speak about themselves. They may say things like, "I can't do anything right," or "Why would you want to spend time with me?" Self-harming tendencies and talk of suicide. As with the above example, to recognize these traits in quiet sufferers of BPD, it is important to pay attention to the way they speak. Their comments relating to self-harm or suicide might seem on the surface to be flippant, throwaway lines, such as, "It makes me want to bash my head against a brick wall." But this seemingly innocuous comment can be a mask for much deeper issues. Having unhealthy boundaries. In the same way that BPD sufferers are prone to black and white thinking, people with quiet BPD will often obsess about a person, seeming to care greatly what this person thinks of them. On the flip side, they may also have times of needing to completely detach from others, pulling away to the point of isolating themselves in order to create what they perceive as a safe space between them and the world. Heightened emotions. People suffering from BPD generally experience emotions much more easily and deeply than the general population. This can have both negative and positive effects. People with BPD often exhibit great levels of excitement, enthusiasm, joy, and love, but conversely, can often feel overwhelmed by negative emotions, such as anxiety, depression, guilt, anger. Everyday emotions are often highlighted, with sadness being transmuted to grief. For example, mild embarrassment being replaced by intense humiliation, and panic taking the place of nervousness. Lack of concentration. Another more subtle trait of BPD is the inability to concentrate. This is often due to the intense emotions building up inside one's head, leaving them with little room to think about anything else. Inability to concentrate is a form of dissociation that can appear as though a person is simply zoning out. A BPD sufferer who has zoned out can be identified by an expressionless face and or flat vocal delivery. They may also appear distracted. Familiarizing yourself with these more subtle symptoms of borderline personality disorder can help you identify whether you or a loved one may be suffering from the illness. If you suspect yourself or someone you love is experiencing borderline personality disorder, it is important to seek professional help. We will be looking at how to get help more closely in Chapter 9. Parts 2 and 3 will also offer tools and tips for managing borderline personality disorder, both for sufferers and their families and friends. Chapter 4. The different faces of borderline personality disorder. Types of BPD. Just as no two people are the same, so too are no two experiences of borderline personality disorder the same. As we've already seen in chapters 1 and 2, there can be a great difference in the behaviors of people suffering from quiet borderline personality disorder and more outward manifestations of the illness. Borderline personality disorder can also be broken down into 4 different types, as proposed by the American psychologist Theodore Millian in his 1995 book, Disorders of Personality, DSM-4 and Beyond. Millian's 4 categories of BPD are as follows. Discouraged borderline. People suffering from discouraged borderline personalities often exhibit avoidant, depressive, dependent tendencies. People with this form of BPD are often submissive and humble and prone to pliant behavior. They often feel hopeless, powerless, and vulnerable. Someone with a discouraged borderline personality can be clingy and tends to go along with the crowd for fear of upsetting the people around them. They can behave in a somber and dejected manner. Below the surface, however, is an anger waiting to erupt. When it does so, it can lead sufferers to self-injury and even suicide. Petulant borderline. A petulant borderline personality is characterized by a heightened sense of negativity. Sufferers of this form of BPD are often highly impatient, stubborn, and resentful. They're sullen and defiant and feel easily slighted. They are easily disillusioned and disappointed in life. People with the petulant borderline personality disorder fluctuate between desperately relying on people and keeping their distance out of fear of being disappointed or let down. Their emotions are prone to swing between feelings of unworthiness and rage. Impulsive borderline. Sufferers of impulsive borderline personalities are prone to histrionic or antisocial behavior. This form of BPD is characterized by frenetic, flighty behavior. They can often be flirty and charismatic, able to draw people to them. They're highly energetic and are constantly seeking the next thrill. However, when things do not go their way, sufferers are quick to become agitated, gloomy, and irritable. They fear any form of loss, leading them to frequent suicidal tendencies. Self-destructive borderline. Self-destructive borderline personalities are often highly depressive and masochistic. They carry around a constant sense of bitterness, which they regularly turn inwards. People with this form of BPD are often prone to self-harming and self-punishing. They're often angry, highly strung and moody, and are prone to suicidal thoughts and behaviors. Their self-hatred is prone to reach extreme levels, leading them to many types of destructive behavior, ranging from reckless driving to poor health care to performing derogatory sexual acts. In addition to these 4 borderline types proposed by Millian, psychologist Dr. Christine Lawson also identified 4 types of borderline personalities in her book, Understanding the Borderline Mother. Borderline Queen. Someone with a borderline queen personality is prone to perfectionism. They're prone to take mild criticism very personally and will become aggressive and indignant if anyone suggests they have made a mistake. Thanks to their perfectionism, borderline queens often dissociate from their own negative traits and emotions, believing them a flaw, so it is often unable to accept his or her own mistakes. People with this borderline personality regularly feel the need to one-up people around them, particularly their therapists and loved ones. Borderline waif. Unlike many other borderline types, the borderline waif does not exhibit a great deal of aggression or outward hostility. Instead, they appear to be fragile and victimized by all life has thrown at them. Waifs are generally depressed and discontented and worry easily. Borderline waifs believe themselves to be helpless victims and often refuse to accept help in order to keep their victim mentality alive. Borderline witch. Someone exhibiting a borderline witch personality can be extremely aggressive and controlling. They seek to punish people for the smallest of indiscretions and are prone to the borderline rage, the destruction of objects that are of value to those they believe have wronged them. Borderline witches are adept at black and white thinking, particularly when it comes to their loved ones. Parents with this personality will often idealize one of their children over the rest, or seek to play one family member off against another. More on this in Chapter 17. People with a borderline witch personality can be extremely domineering and intrusive, often violating the boundaries of those around them. They're prone to using the thoughts and feelings of those around them as a weapon, leading their loved ones to become withdrawn and restrained in their presence. Borderline witches can be extremely paranoid and suspicious, with their hostile behavior making their own fear of loss of control. Borderline hermit. People with a borderline hermit personality view the world as an inherently dangerous place. They have large amounts of paranoia and suspicion and have trouble trusting those around them. Thanks to their belief that everyone is out to get them, borderline hermits will withdraw from the world and isolate themselves. For many sufferers of a borderline hermit personality, the disorder stems from sexual abuse or other equally damaging childhood trauma. Chapter 5. What are the causes of borderline personality disorder? As mentioned in Chapter 1, the causes of BPD, like many other mental disorders, remain unclear. Experts believe BPD is unlikely to be caused by any single factor, but rather a combination of contributing elements. Some of the factors that are believed to contribute to this disorder include genetics. Having a parent with borderline personality disorder may make you more susceptible to the illness. Studies have shown that in the case of identical twins, when one twin has the disorder, the other has a 2 in 3 chance of developing it as well. At present, however, there is no definitive proof that a gene exists for BPD, meaning genetics' effect on borderline personality disorder is still under question. Issues with chemicals in the brain. Experts believe many people who suffer from BPD have problems with the neurotransmitters in their brain. Neurotransmitters are chemicals that act as messengers, transmitting signals between the brain cells. In particular, altered levels of the neurotransmitter serotonin are thought to play a part in the onset of BPD, as serotonin levels have been linked to depression, aggression, and destructive urges. Issues with brain development. Thanks to MRI scans conducted on sufferers of BPD, researchers have identified that the condition may be associated with issues in 3 specific parts of the brain. In many people with BPD, these parts of the brain were either undeveloped or showed unusual activity. These parts are the orbitofrontal cortex, responsible for decision-making and planning; the hippocampus, which is responsible for regulating behavior and exhibiting self-control; the amygdala, which plays a substantial role in the control of negative emotions, such as aggression, anxiety, and fear. Environmental factors. Genetic and biological factors, such as brain makeup, are far from the only elements believed to play a part in the onset of BPD. A number of environmental factors are also common among sufferers of borderline personality disorder. Many of these stem from our experiences as children, as our childhood plays such an enormous part in the shaping of our adult lives. Some of the issues experienced by BPD sufferers include parental neglect as a child, being a victim of emotional, physical, or sexual abuse, particularly as a child, being exposed to long-term fear or stress, particularly as a child, growing up with a family member who suffered from a serious mental condition or who had problems with drug and alcohol abuse. Issues of neglect or abuse in childhood can manifest themselves in a number of different ways in our adult life. Childhood trauma can cause us to bury our true feelings and present a false self to the world, can drive intense feelings of lack of self-worth, and cause a range of attachment issues that present themselves in all kinds of relationships. For sufferers of BPD, the effects of childhood trauma can be seen in traits such as expecting others to be a parent to you, idealizing others, or expecting others to bully you. Chapter 6. Diagnosing Borderline Personality Disorder. As discussed in Chapter 2, if you believe yourself or a loved one is suffering from borderline personality disorder, it is crucial to get professional help as soon as possible. BPD can lead to violence, damaged relationships, any number of dangerous behaviors, and even suicide. It is not something that you should attempt to handle without the help of a trained psychologist or other mental health professionals. Self-diagnoses. While you've likely identified several of the traits mentioned in Chapters 1 and 2, the following questions can help you determine whether you might be affected by BPD. Do your emotions change very quickly? Do you often experience extreme anger, sadness, or distress? Do you often feel empty or unfulfilled? Are you constantly afraid the people I care about will leave me? Are most of your romantic relationships intense and unstable? Does the way you feel about the people in your life tend to fluctuate from one extreme to the other? Are you ever tempted to engage in self-injury or attempt suicide? When you feel insecure in a relationship, do you ever lash out or behave impulsively in a desperate attempt to keep your lover close? Do you ever engage in dangerous behavior, such as binge drinking, drug use, unsafe sex, or reckless driving? If you or your loved one answered yes to several or all of these statements, it may indicate borderline personality disorder. Professional diagnoses. BPD will be officially diagnosed following a clinical assessment by a mental health professional. The generally accepted method of diagnosis involves presenting the patient with a list of characteristics and asking them whether they feel such characteristics accurately represent them. By actively involving patients in their own diagnosis this way, sufferers are likely to come to terms with the disorder more quickly. Mental health experts have produced a list of 9 symptoms associated with borderline personality disorder. For a person to be diagnosed with BPD, they must exhibit at least 5 of the following traits: fear of abandonment, unclear or changing self-image, unstable relationships, impulsive and or self-destructive behaviors, tendency towards self-harm or suicide attempts, extreme mood swings, difficulty controlling rage, paranoia or suspicion of others' motives, persistent feelings of emptiness. Such an evaluation will also discuss the severity of these symptoms and when they began, along with determining when they may have begun. Of particular relevance are any suicidal thoughts a patient may have experienced, along with thoughts of self-harm or doing harm to others. An assessment may also include physical tests to rule out other triggers of these symptoms, such as thyroid conditions or drug and alcohol abuse. As previously mentioned, BPD can sometimes be misdiagnosed thanks to its similarities to other mental health disorders, such as depression, bipolar disorder, and post-traumatic stress disorder. As a result, mental health professionals might experiment with a range of treatments and therapies in order to identify the most suitable path towards recovery. So, what if you or a loved one has been diagnosed with borderline personality disorder? What does this mean for your relationships and your life in general? There's no doubt that BPD presents an enormous array of challenges to both the sufferer and those around them. But all is not lost. In the following sections, we will take a look at how to cope if borderline personality disorder has become a part of your life. Part 2. How to cope if you suffer from BPD. Chapter 7. What to expect if you've been diagnosed with borderline personality disorder. So, you've been diagnosed with borderline personality disorder. Perhaps this has come as a cruel shock. Or perhaps you may even welcome the diagnosis as an explanation to your previously unexplainable emotional outbursts and mood swings. It feels like a relief to know that this behavior is the cause of an illness rather than another part of yourself. Regardless of how you feel about your diagnosis, there's no doubt that living with borderline personality disorder can be a hellish experience, both for you and your loved ones. BPD can affect every part of your life, from your relationship to yourself and others, to your education, career, and recreational life. Your tendencies to act out and behave in violent and aggressive mean that both you and your loved ones are prone to being hurt, both physically and mentally. Learning to manage the disorder begins with understanding. By knowing exactly what to expect, you can prepare and develop coping skills to help you weather the emotional storm. Having a deep understanding of your illness and its traits will also help you communicate better with your loved ones about BPD, making it easier for them to assist you with the struggles you'll face. We will address this more in Chapter 12, but for now, let's take a look at exactly what you can expect if you have been diagnosed with BPD. How you may feel towards yourself. If you've been diagnosed with BPD, you can expect to feel the following ways about yourself: overwhelmed by the intensity of your feelings and rapid mood swings, lonely, as though you are inherently flawed, as though you are to blame for everything bad that happens to you, as though you have a hard time deciding what you want in life, or even what you like or dislike, as though you are a bad person, as though you are not a real person, as though you are a child forced to live in an adult's world, as though you don't know who you really are, as though someone you are unable to identify is missing from inside you. These negative feelings toward yourself can cause you to act out in the following ways: keeping very busy so you're never alone with your thoughts, regularly changing plans, hobbies, or even jobs as you struggle to identify who you really are, overspending and binge eating, using recreational drugs and or smoking, excessive use of alcohol to help dampen your emotions, avoiding seeing things through, refusing to attempt activities you think you might fail or might otherwise cause you to feel disappointed, how you may feel towards others. Of course, borderline personality disorder also plays a huge role in the way you relate to the people around you. BPD can cause you to act with aggression and hostility towards those you love, causing them both physical and emotional pain. But again, understanding exactly how BPD can make you act and think can help you manage these outbursts and limit the damage to those you care about. Here are some of the ways BPD can cause you to think or behave around others. You may feel as though no one understands you and what you're going through. You may inherently differ from everyone around you. You may believe that the world is a dangerous place that you want only to run away from. You may believe that people are either completely perfect or completely bad and hurtful with no middle ground. This is known as black and white thinking. You may fear your friends and loved ones will leave you forever if they get upset or angry with you. These feelings can cause you to act in the following ways around other people: getting extremely frustrated and angry with those around you, having difficulty trusting people, even those you love, wanting and needing to be close to people, but fearing they will leave you, so avoiding them, having unrealistic expectations of your friends and loved ones, ending relationships with partners and friends if you think they might leave you, constantly looking for signs within your relationships that signal someone is going to leave you. As you no doubt already know, borderline personality disorder can be exhausting. The constant swings from exhilarating highs to crushing lows can make it feel as though you are trapped on an endless emotional roller coaster. But the good news is, with treatment, most sufferers of BPD experience a complete or partial improvement of their symptoms. Many people find their symptoms improve markedly within a few years of their diagnosis. In addition, if someone experiences a complete departure of their symptoms, there is a good chance the symptoms will not return in the future. In the following chapters, we will begin to look at the many tools and techniques available for managing borderline personality. While the road ahead is guaranteed not to be an easy one, there is hope. With patience and perseverance, you too can be one of the many people with BPD who go on to live productive and successful lives. Chapter 8. Learn to control the emotional storm. It is the emotional storm that most pointedly characterizes borderline personality disorder, that wild fluctuation of emotions you feel as though you have no control over. This emotional storm can leave you feeling utterly helpless, frustrated, and/or detached from your body. When in the grip of the emotional storm, it can feel as though there is no way out. But the reality is, there are many techniques you can implement to help you through the situation. By studying the following techniques at a time when you're feeling calm and centered, you will be much more prepared and able to manage the emotional storm when it hits. Developing a plan of attack to deal with such a situation can help you feel more in control the next time your emotions threaten to overwhelm you. Let's take a look at a few of the techniques that can be implemented when it comes to managing the emotional storm. Identify your emotions. The first step in managing your emotions, it is developing the skills to recognize exactly what it is you're feeling. When you're in the midst of the emotional storm wrought by BPD, it can be difficult to discern just what is going on. You are literally in a state of chaos, and you may be experiencing a number of conflicting emotions at any one time. If you are feeling emotionally overwhelmed and unable to pinpoint exactly what it is you're feeling, it can help to work through the situation a moment at a time. Focus on getting through 1 minute, then the next, then the next. Breaking down the situation into smaller, more manageable tasks can help it feel more manageable. Focusing on identifying a single emotion within the storm can also help to manage the overwhelm. Give a name to exactly what it is you're feeling. Is it anger or frustration, exhilaration, grief? Try to identify the emotion without trying to find the reason for its appearance or bring it to a halt. Here are some of the physical symptoms you will experience with a number of emotions which may help you identify exactly what it is you are feeling. Anger. Quickened heart rate. Quickened breathing. Tense muscles. Tapping your feet. Clenching your fists or your jaw. Sadness and depression. Physical ache in your chest. Decreased appetite. Fatigue. Insomnia. Anxiety and panic. Sweating palms. Dilated pupils. Body aches. Body temperature changes. Chest pain. Chills. Choking sensation. Dry mouth. Increased heart rate. Nausea. Shortness of breath. Tingling sensations. Once you have identified exactly what it is you're feeling, you can begin to implement techniques for calming these emotions. See Chapter 10 for more details on calming specific emotions. Accept your emotions. Now you have identified the emotions you are feeling. The next step is to accept them. This is a crucial step when it comes to calming the storm of emotions raging inside your head. This can be an extremely difficult thing to do. You will now have a great deal of resentment for the disorder, along with the emotions it causes you to feel. Accepting them may seem like an impossible task. But it is important to understand that accepting your emotions is not the same things as approving of them or accepting that there is no chance of change. It just means that you keep yourself from trying to push away and suppress these feelings or deny what is happening. By allowing yourself to feel the true intensity of your feelings, rather than battling to keep them away, you actually take away a great deal of their power. Endeavor to just let your feelings be, without engaging in self-criticism or judgment. See if you can focus on the present moment without giving rise to thoughts of the past or future. Try some of the following techniques. Imagine you are observing your emotions from the outside. After all, you are not defined by your emotions. You are not your anger, or your grief, or frustration, or anxiety. Attempt to view your emotions as what they truly are, something separate from yourself. Observe the ways your emotions come and go. It can be helpful to think of them as waves. Imagine them ebbing and flowing, increasing and decreasing in intensity. This also strengthens your ability to see your emotions as something separate from yourself. Pay attention to your physical body. How do these emotions manifest inside you? Do they cause you to feel tension or pain? Where? Does this pain or discomfort move as the feelings increase and increase? Try and pinpoint exactly where you can feel the manifestation of the emotion. And what does it feel like? Is it a dull ache, a sharp pain, a burning, a tingling? Tell yourself it's okay to be feeling these emotions. Accept them for what they are. Remember, accepting them does not mean you approve of them, and it does not mean you're giving them permission to be here forever. Tell yourself that just because you are experiencing these emotions right now, it does not mean they are reality. Your emotions are a result of your thoughts, and all thoughts can be changed. Engage in mindfulness practices. Engaging in mindfulness practices can also be a great help in learning to manage the chaos of the emotional storm. Mindfulness is a form of meditation, and that helps people manage their thoughts and feelings. It is used increasingly in the treatment of mental health disorders and is recommended by NICE, the National Institute for Health and Care Excellence, in the treatment of depression, among other illnesses. Thanks to the way it helps practitioners manage and become aware of their emotional states, mindfulness can also be extremely beneficial when it comes to treating borderline personality disorder. The mindfulness state can be reached through a number of methods. Here are a few mindfulness techniques to try if you are new to the practice. Standard mindfulness meditation. Focus on your breathing. Feel the breath move in and out of your body and become aware of its rhythm. If you become aware of thoughts arising, simply notice them. Let them go by imagining them drifting away down an imaginary river. You can achieve the same result by focusing on a mantra, a repeated phrase, in place of the breath. Sensory mindfulness meditation. Pay attention to each of your senses. Identify 5 things you can see, 5 things you can hear, smell, touch, and even taste. Challenge yourself to describe these sensory experiences in great detail. For example, rather than simply saying, "I see a butterfly," describe to yourself exactly what it is you're seeing. I see a butterfly with dark yellow wings and small semicircular black spots. Its legs are moving slowly in a back and forth action. Apply the same level of detail to the descriptions of things you hear, smell, feel, and taste. This is an excellent way to ensure you are engaged in the present moment and not focusing on the past or future. Bodily sensation and mindfulness. Close your eyes and become aware of the subtle sensations within your body. Do you feel an itch, a gentle ache, a tingling? Do not try to fight these feelings. Simply become aware of them and allow them to pass. Work your way from the top of your head to the tips of your toes, mentally scanning every inch of the body. Paying close attention to what you notice, proving the same depth of description you would in a sensory meditation. Emotional mindfulness. Arguably, the most beneficial type of mindfulness when it comes to managing BPD. This calls on you to allow and accept arising emotions without passing judgment. Rather than fighting your emotions, simply try to name them. Exactly what is it you're feeling? Anger? Jealousy? Frustration? Joy? Whatever it is you're feeling, accept it and then let it go. Imagine your emotion floating away down the river in the same way you would discard an errant thought during a standard mindfulness meditation. Learn to control your impulses. As any sufferer of borderline personality disorder knows, BPD is a constant struggle of battling your impulses. The sudden mood swings can drive you to impulsive, reckless, self-damaging behaviors ranging from self-harming to dangerous driving to unsafe sex. You likely know these things are no good for you, but it can feel like the only way of easing the chaos inside your head. It can often feel as though you have no choice but to engage in these behaviors. Though it may not seem like it in the heat of the moment, these impulses can be managed. Begin by acknowledging that these reckless, impulsive behaviors have a purpose. They are coping mechanisms that help you deal with distress and should be seen as such, rather than a cause for punishing yourself. But as you no doubt are aware, these reckless behaviors can put both you and those around you in danger. It is important to find healthier and less damaging ways of coping with the distress BPD can cause. In order to do this successfully, you must learn to tolerate this distress, rather than immediately seeking to relieve it. But building your tolerance, you will be able to step back and give yourself a moment to think. When you feel the need to act recklessly, as BPD can so often drive you to do. By becoming able to tolerate distress, you'll be able to ride out the experience without resorting to damaging behaviors. No doubt this sounds much easier said than done, so let's take a look at a few of the techniques you can implement to begin to build your tolerance to distress. Lower your body temperature. When we get angry and frustrated, our body temperatures often rise. Lowering your body temperature can help calm the anger within. Do this by splashing cold water on your face, standing in front of a fan or air conditioner, or stepping outside if you're in a warm building. The change in temperature will have the effect of cooling you down, both emotionally and physically. Engage in high-intensity exercise. Vigorous exercise is a great way to ease many intense emotions. The next time you feel overwhelmed and about to act out, turn to exercise instead. Sprint around the block or swim a few laps. It can even be something as simple as doing a few jumping jacks or running the spot for a few minutes. The increase in oxygen flow will greatly aid in managing your distress. Being physically exhausted also makes you far less likely to engage in dangerous and reckless behavior. Focuses breathing. Paying attention to your breath, much the same way as you would do in meditation, can be a useful technique in managing distress. Force yourself to breathe in a rhythm, giving yourself 5 counts in, hold for 2 counts, then release. Repeat as many times as you need. Tense and relax your muscles. When we're tensed or stressed, our muscles can involuntarily become tense. But deliberately tensing your muscles and then consciously releasing it, you will be able to enter a deeper state of relaxation. Try tensing your fists as hard as you can and holding it for a count of 10. Keep squeezing harder and harder. On the count of 10, release your fists. You will feel your muscles become far more relaxed than they had initially been. If you're feeling distressed, try this technique in as many places around your body as you can. Tense each muscle and then feel them relax more deeply as you release the hold. Find an activity that calms you. The next time you feel distressed and ready to act out, force yourself to engage in a different activity. This can be any activity you choose, as long as it is a healthy one that will not put yourself or others in danger. This helps by taking your mind off the negative emotion and forcing you to concentrate on the task at hand. It can be helpful to put together a list of activities you enjoy doing. They could be something as simple as taking a walk or reading a book, through to playing a musical instrument, doing a sport, or baking a cake. The next time you feel distressed, you will have this list to turn to. Do something kind. Though being kind and generous may be the last thing you feel like doing while you're lost in your own problems, engaging in an act of service is a great way to help you through your distress without resorting to reckless behavior. Bake cookies for someone, wash a neighbor's windows, or help out with tasks around the house. Not only will this distract you from your stress, it will have the added benefit of making you feel good about yourself, helping with your sense of self-worth. As with the above suggestion, when you're feeling good, it can be helpful to make a list of helpful tasks you can engage in that you can refer to the next time stress takes hold. Keep your mind busy. If you need a quick distraction from the chaos of thoughts inside your head, engage in an activity that forces you to keep your mind busy. Try saying the alphabet backwards, or recite your times tables. Use positive imagery. Imagine the way you would like to respond the next time you feel like acting recklessly. How would ideally like to manage the distress? Imagine what this would look like. Allow yourself to really feel the way this would feel. This exercise can be done both when you're feeling good and when the distress begins to take hold. By imagining the ideal outcome, you may be able to change the way you behave in reality. Give meaning to the situation. We've already discussed the way reckless behavior has a purpose, in that it acts as a mechanism in times of distress. But what other meaning can you give to the way you're feeling? Perhaps your battle with your distress has given you the strength to face it again next time it arrives. Maybe it has taught you how you don't wish to behave. Maybe you received help from someone unexpected, and the situation allowed you to create a new relationship. Make a pros and cons list. If you are battling with yourself about whether to engage in reckless behavior, such as going on a massive shopping spree or sleeping with someone you know you shouldn't, take a few moments to write down a list of the pros and cons. What will the benefits be to engaging in this behavior, and what are the likely consequences? The act of doing this will hopefully not only allow you to see the repercussions of your reckless actions, but may also provide you with that moment of thought you need to remove yourself from the intensity of the situation. Chapter 9. Who can help you? If you are suffering from borderline personality disorder, it is important to know that you are not alone. In Part 3, we'll be looking more closely at how your loved ones can help you manage the illness, but it is important to acknowledge the vast array of healthcare professionals who are trained to help sufferers of borderline personality disorder. While psychiatrists and psychologists are often the first people we turn to in the treatment of BPD, the condition can also be treated by GPs and nurses, along with occupational therapists and social workers who have undergone specials training. Some major cities worldwide also have specialized mental health services dedicated to patients suffering from BPD. Finding the right healthcare professional. Finding the right therapist to work with can be a challenge. With so many options out there, even knowing where to begin can be a challenge. While your GP will often be able to assist you in finding a therapist well-versed in dealing with borderline personality disorder, it is important that you play an active part in finding a person you feel comfortable working with. After all, for therapy to be successful, you'll need to open up to your therapist and feel safe doing so. So, how do you begin the daunting task of finding the right therapist for you? Begin by narrowing down your options. You already know you want a therapist with experience treating BPD, of course, but think about what else you require. For example, how far are you willing to travel to get to your appointments? What is your budget? Do you have a preference for a male or female therapist? Apply these filters to your list of therapists to create a short list of potential candidates. Next, take your time to read through the profiles of the therapists on your short list. Take note of not only what they offer professionally, but any information they might provide about their personal lives. It's good to use your instinct here. Who do you get a good feeling from? Is there anyone who makes you feel uncomfortable? Understand the different approaches each therapist takes when it comes to managing BPD. Is there a specific type of therapy you've been recommended by your GP, or one you would feel would be most beneficial for you? Carefully examine the courses of treatment each therapist offers and learn as much as you can about each method of treatment. Once you've found the therapist you feel may be right for you, take up their offer of a free consultation before committing to anything more long-term. It's important that you feel a connection to your therapist and that you feel they understand you. At the initial consultation, be sure to ask questions in order to come away with all the information you need to make a decision. Here are a few things you might consider asking. Are you experienced and comfortable in treating people with borderline personality disorder? Do you have any special training when it comes to the treatment of BPD? If so, what? How do you approach treatment? Are you comfortable with me expressing my emotions during our sessions? Do you feel comfortable with me raising sensitive issues in my life? How will you determine if your treatment is working? What will your next step be if the treatment is not successful? How often will we have sessions? How long will each session last? Does your treatment involve my partner and family? If so, how? Am I able to call you if I'm experiencing a crisis? If not, can you provide details of someone I can call? What are your fees? Will they be covered by my health insurance? As BPD often exists in conjunction with other mental health issues such as eating disorders, post-traumatic stress disorder, bipolar disorder, and depression, it is important to keep your therapist updated on any new issues or changes in your behavior that may present themselves. In this way, you can both keep on top of any alterations in your condition, and treatment can be adjusted accordingly. As an adult, you should expect your healthcare provider to give you all the information and assistance you need to deal with your illness. You should be given the choice to make your own decision when it comes to treatment. Often, your healthcare provider will involve your partner or family in the discussion. Be sure to ask questions about anything you do not understand. Things you can do to increase the likelihood of success. To give yourself the best chance of defeating the BPD, you must take an active role in your treatment. Just relying on your psychologist or other healthcare provider will not be enough to manage the emotional chaos that arises with the disorder. By taking the following steps, you'll be greatly increasing the chance of successful treatment. Work with your psychologist or other healthcare provider, along with your partner and or family, to make a plan for the management of your BPD. Be sure to attend all of your appointments. Be honest and open with your psychologist. Tell them about anything that is worrying you. Be open to change with regards to your daily life. Allow your psychologist to offer suggestions and do not disregard them without due consideration, even if they may seem uncomfortable at first. Be sure to do any homework set for you by your psychologist. Be honest when it comes to the way BPD affects you. Analyze your illness and understand the way it makes you act. Learn how to manage your impulses and emotions, and develop ways of coping without resorting to self-harming or destructive behavior. See Chapter 8 for further information. Be patient and persistent. Keep trying different treatment options until you find one that works for you. Get as much reliable information about the disorder as you can. The more you know and understand about BPD, the easier it will be to manage. Design and implement a plan to get you through crises. Having a plan in place will help you think more clearly in times of distress. The plan should highlight things you can do to get through the crisis, along with things that should be avoided. See Chapter 8 for further information. Include things your loved ones can do for you, along with people you can contact in times of crisis. What to expect with regards to recovery. If you are suffering from a physical illness, recovery is often a black and white thing. You're sick, and then you're healed. But as you likely know, recovery is completely different in causes of mental illness. Very rarely does recovery mean a complete elimination of symptoms. It is unlikely, though not impossible, that you will ever be able to completely dispense with the need for therapy, medication, or other treatments. Nonetheless, many people suffering from BPD have seen marked improvements in their conditions through a variety of treatments. When dealing with borderline personality disorder, recovery can be measured in a number of ways. When you're in recovery, you will experience less frequent emotional outbursts, and these outbursts will decrease in intensity. You will have less incidences of self-harming and other impulsive, reckless behavior. While it is of course possible that there will be relapses, you will be able to resolve these crises much more quickly than you did in the past. As your symptoms improve, you will likely feel more and more confident taking steps towards living a full and successful life. Chapter 10. Useful Tools. Learn how to change your brain. As crazy as it sounds, learning how to alter the function of your brain is a key way to managing borderline personality disorder. As discussed in Part 1, BPD is often linked to neurological abnormalities. So, what are you to do if your brain does not function in the same way as others? Surely, that's just something you have to live with, right? Not necessarily. Each time you engage in a healthy coping response, such as those outlined in Chapter 8, you're developing new neural pathways. Skills and treatments such as meditation and mindfulness have also been proven to grow and strengthen brain matter. The more you practice, the stronger these pathways will become. Before you know it, the learned behavior will become automatic. With time and patience, you'll have the ability to change the way you feel, behave, and think. Stimulate your senses. Engaging one or more of your senses can be a good way to manage the emotional challenges of BPD. As each person is different, it's a good idea to experiment with stimulating different senses to find out what works best for you. You may also find that what works for you changes depending on just what it is you're feeling. Something that is effective for you when you're feeling numb or empty may not work to calm anger or frustration. There are, of course, an endless array of ways to stimulate your senses, but here are a few techniques to begin with. Start here, and then experiment to find out just what works for you. Sight. Seek out an image that captures your attention. This may be something in your immediate environment, such as a view, a piece of art, or an inanimate object, such as a book or table. Or it could be an image you see in your imagination. Allow yourself to appreciate the colors and textures you see. Bright colors will have the effect of stimulating you if you feel empty or numb, while cooler colors can have a calming influence on anger or frustration. Taste. Stimulating your taste buds can help when you're feeling numb and empty. Try eating foods with intense flavors, such as lemons, chilies, or strong flavored mints. Alternatively, if you're seeking to calm your anger or agitation, warming foods such as tea and soup can help. Touch. If you're feeling numb, try holding a piece of ice or running chilled or warm water over your hands. Gripping tightly to an inanimate object could also be helpful. If you need to calm yourself, a hot shower, warm bed, or cuddles with a pet can be beneficial. Smells. If you're familiar with aromatherapy, you will know the immense power of scents. You will find essential oils available to manage any emotions. For example, scents such as lavender, ylang-ylang, or chamomile can calm you. Orange and sandalwood can have a stimulating effect, while rose, frankincense, and basil can help alleviate anxiety. Also, take the time to identify scents around your home that calm or stimulate you. For example, does the smell of clean laundry have a calming effect? How does the scent of freshly cut grass make you feel? What about the scents that come out of your kitchen? Pay attention to the way you feel when you smell different foods cooking. Sound. If you are struggling with emptiness or numbness, loud music, whistles, or buzzers can help jolt you back to reality. To calm your emotions, try soothing music or natural sounds such as birdsong, rainfall, or ocean waves. If you don't have access to the real thing, there are many recordings available on places like iTunes or YouTube. Activities to soothe your emotions. While we have already touched on the role of activities when it comes to focusing your attention, specific activities can have the effect of soothing our emotions. Just like the sensory stimulation, different things will work for different people. So it is important to experiment and find what works for you. Here are a few places to begin. If you're feeling anxious, tense, or panicked, try taking 10 deep breaths, counting them out loud. Taking a warm bath or shower. Engaging in mindfulness by making yourself a hot drink and drinking it slowly, paying attention to the smell, the taste, and the feel of the mug in your hands. Write down every detail you can about where you are in this moment. Include details about the room, the weather, the time, date, etc. Go for a walk. If you're feeling angry, restless, or frustrated, try hitting a pillow. Throwing ice cubes into the sink, make them smash. Tearing up a newspaper. Doing some vigorous exercise, such as boxing. Doing a practical activity, such as gardening or handiwork. Listening to some loud music. Focusing on your breathing. This will force you to focus on something other than your anger. Counting to 10 before you react. This buys you a little time to think. Taking yourself out of the area. Take a short walk around the block, or even just remove yourself to a different room from the person or situation that is causing you anger. If you're feeling depressed, lonely, or sad, try writing all your negative emotions on a piece of paper and tearing it up or burning it. Listening to a piece of music or song you find uplifting. Writing a loving letter to the part of you that is experiencing the sadness or loneliness. Wrapping yourself up in a blanket and watching your favorite movie. Cuddling a pet or soft toy. Doing some exercise. When you're not feeling sad or depressed, make a list of things you enjoy doing, such as playing a musical instrument, walking in nature, or watching your favorite TV show. The next time you're struggling, refer to this list and do one of the activities. If you feel detached, disassociated, or lost in your own world, try clapping your hands together hard and paying attention to the way it feels. Chewing a chili or piece of ginger. Splashing your face with cold water. Walking barefoot and paying attention to the feel of the ground beneath your feet. When you are not experiencing an episode of disassociation, write notes to yourself in places where you will see them. The next time you feel detached, use these notes to anchor you in the world outside your head. If you feel as though you want to self-harm, try rubbing an ice cube over the place you want to hurt yourself. Stick tape over your arm and pull it off. Take a cold bath. Reduce your vulnerability. Give yourself the best chance of fighting negative emotions by taking care of your physical and mental well-being. Be sure to do the following. Do plenty of exercise. Get a good night's sleep. Eat a balanced diet. Avoid excessive use of drugs and alcohol. Practice relaxation techniques such as meditation. Psychoeducation. Psychoeducation is a useful tool that can be of great value to sufferers of borderline personality, along with their loved ones. It helps people with BPD and those around them understand the disorder at a deeper level. Psychoeducation programs cover symptoms of the disease along with treatment options, recovery methods, and available help. Psychoeducation can take place either individually or in groups. It may comprise of written information person meetings, websites, videos, or discussion groups. Speak to your healthcare provider if you're interested in pursuing psychoeducation for you and your family. Medication. Using medication in the treatment of borderline personality disorder has its roots in the 1980s. Since then, there has been a marked increase in the success of psychotherapy in managing the disorder. Thanks to this, many healthcare professionals believe medication, in conjunction with psychotherapy, is an effective way of managing the illness. As BPD is believed to be caused, at least in part, by biological disturbances, such as chemical imbalances in the brain, many of the symptoms caused by these imbalances can be addressed through medication. Medication has proven to be effective in the rapid stabilization of emotional outbursts and aggression BPD sufferers can direct at both themselves and others. There has not been any form of psychotherapy to date that provides the same immediate response. In addition, medication has been proven to improve elements of BPD that are usually unresponsive to psychotherapy, such as paranoia, black and white thinking, high levels of suspiciousness, and disassociation. In some cases, the medication has such a profound effect on altering these biological processes that, in conjunction with psychotherapy, they decrease to the point of medication no longer being required. There are 4 classes of medications usually used in the treatment of BPD. Antipsychotic agents. These have been proven to assist with mood regulation and decrease the incidences of self-injury paranoia, hostility, black and white thinking, and depression. Because of their ability to counter a wide range of symptoms, antipsychotic agents are considered one of the most useful classes of medications in the treatment of BPD. They are commonly used to treat other mental illnesses, including schizophrenia and bipolar disorder. However, when prescribed at a lower dosage, they can also be extremely beneficial for sufferers of BPD. Mood stabilizers. This class of medication is known to improve unstable moods, anxiety, irritability, and problems relating to others. They do not, however, reduce black and white thinking, paranoia, or disassociation. All common symptoms of borderline personality disorder. Because of this, many psychotherapists will prescribe both a mood stabilizer and an antipsychotic agent. Anti-anxiety agents. These have been proven to reduce anxiety, irritability, depression, and agitation. They can also be beneficial for sufferers of BPD who have difficulty sleeping. However, thanks to their highly addictive nature, they're used with caution in the treatment of BPD. There have been several cases in which the use of anti-anxiety agents have been reported to increase impulsive behavior in BPD sufferers. Nutraceuticals. This class of medications has been proven to reduce anger, depression, and aggression. The effectiveness of these medications will depend on several factors, namely the patient's specific symptoms, the medication selected, and the degree to which the sufferer's disorder is caused by a biological imbalance. Because of this, medication which works for one person may not work for another. It may take some trial and error to determine which medication is right for you. However, it is important to note that many psychotherapists, as well as medical advisory group NICE, are against the use of medication in the treatment of BPD. Medication can lead to addiction and may not be effective when a patient's disorder is caused by environmental factors rather than biological. For the same reasons, many patients are also resistant to taking medication to aid their condition. Despite these conflicting ideas, the majority of therapists and doctors agree that the best way of tackling BPD is through a combined approach of medication and non-medical treatments such as CBT. Medication alone is rarely a suitable treatment plan. Speak to your GP, therapist, or other healthcare professional to discuss whether medication is the right treatment approach for you. Chapter 11. Specific Therapy Skills for Managing BPD. These days, there are two main methods of therapy used to treat BPD: cognitive behavioral therapy and dialectical behavior therapy. Let's take a look at these two methods in order to understand their roles in the treatment of borderline personality disorder. Cognitive behavioral therapy skills. Cognitive behavioral therapy, or CBT, aims to alter the way a person thinks and behaves. The effectiveness of this therapy relies heavily on a patient's connection and relationship with their therapist, along with their willingness to change. CBT is commonly used to treat a range of disorders including depression, anxiety, addictions, and phobias. CBT is generally a short-term treatment, and thanks to this, it often is more affordable than other types of therapies. It usually focuses on helping clients deal with a very specific problem. How cognitive behavioral therapy works. CBT operates on the premise that our behavior is heavily influenced by our thoughts and feelings. For example, someone with low self-esteem may believe that when they're in public, people are constantly judging them. As a result, they shy away from social occasions and prefer to spend time alone. Cognitive behavioral therapy aims to teach patients that they cannot control every element in the world around them. They are responsible for the way they perceive these external events. One of the main goals of CBT is the removal of a patient's automatic negative thoughts and the replacing of them with something more positive and productive. These automatic thoughts, such as, "I'm not good enough," or "I will never succeed," often have their roots in early childhood, and, as the name suggests, pop into a person's head without them having any control over it. Someone experiencing automatic negative thoughts will generally accept them as true. Thus, the thoughts will have a great effect on their mood and can contribute to depression, anxiety, and other emotional difficulties. The first step of CBT therapy is to identify the automatic negative beliefs a patient is experiencing. This process is done under close guidance of the therapist and is important for learning how negative thoughts and beliefs can play a part in a person's behavior. This can be a challenging process, especially for someone uncomfortable or unfamiliar with introspection. The second part of CBT asks patients to challenge and examine these negative thoughts, seeking evidence from reality to either support or refute their beliefs. For example, Perhaps the person suffering from low self-esteem had an experience in which they were out in public and saw someone of the opposite sex laughing while facing in their direction. At the time, they automatically assumed this person was laughing at them. But CBT calls the patient to examine situations such as this. Perhaps the person was laughing at a friend who was standing behind them. Perhaps the friend told a joke or pulled a face. In likelihood, it had nothing to do with the patient at all. Doing this allows patients to look more objectively at the thought patterns that are contributing to their mental state. Once the patient is aware of the negative beliefs that come into their heads on a regular basis, they're able to catch themselves thinking these things, thus replacing the negative thought with a more positive one. For example, "I'm not good enough" can be replaced with "I am enough." Through CBT, patients will also develop new coping skills to help them manage challenging situations. For example, patients with phobias will undergo exposure therapy. Drug addicts may rehearse ways to avoid social situations in which there may be drugs present, and sufferers of BPD may work on building skills to help them cope with emotional outbursts. The next step in the process may be rehearsing conversations with friends or family, in which the patient can implement the new beliefs and thought patterns they've been developing. By breaking the process into smaller goals this way, it becomes much more manageable. While the therapist takes a very active role in CBT, the patient must be willing to put in a great deal of work, both in the sessions and in their daily life. They'll often be given homework tasks to complete between sessions. CBT is much more structured and goal-oriented than psychoanalytic types of therapy, which can be quite open-ended. It is well suited for people who want a short-term treatment to their emotional distress, along with skills they can use to manage their behavior long into the future. Dialectical behavioral therapy skills. Dialectical behavioral therapy, or DBT, is a type of cognitive behavioral therapy that has been modified to specifically treat borderline personality disorder. Developed by Dr. Martha Linehan at the University of Washington, DBT focuses on skills specifically associated with the disorder, such as mindfulness, controlling emotions, handling distress, and cultivating relationships with others. Often referred to as talk therapy, DBT, like CBT, focuses on cognition, in particular, the way our thoughts and beliefs affect our actions. DBT was the first type of psychotherapy proven to be successful in the treatment of borderline personality disorder. Thanks to its rapidly growing body of documented successes, DBT is considered one of the best ways of treating borderline personality disorder. DBT is based on the theory that the problem at the heart of borderline personality disorder is the inability to regulate emotions. DBT works on the premise that this inability comes about from a mix of biological and genetic factors and a traumatic childhood in which a child's caregivers either punished and trivialized a child's emotional needs or behaved erratically towards them. DBT aims to help patients build a skill set that will help them manage and regulate their emotions. There are 4 main types of skills that a patient will develop while undergoing DBT. These are mindfulness skills. This part of the process focuses on building meditative skills which allow the BPD sufferer to experience and acknowledge all the emotions and thoughts they are experiencing without judgment. The patient is taught to simply witness and experience the emotions, giving a name to what they're feeling: sadness, frustration, excitement, etc., without labeling them as good or bad. These are considered the core skills a patient needs to succeed in managing their emotions. Interpersonal skills. This part of the DBD process focuses on building skills needed to relate successfully with others. It teaches patients to communicate effectively and assert their needs and managing conflict within relationships. Distress tolerance skills. This section of the process trains patients to tolerate, accept their distress without resorting to reckless or self-damaging behavior. Emotional regulation skills. This focuses on increasing the patient's ability to identify and manage their emotional reactions to situations that may arise. Structure. DBT is made up of specific elements that are introduced over the course of a year or longer. These elements are individual therapy sessions. This uses CBT techniques such as cognitive restructural and exposure therapy in order to change patients' behavior and improve their quality of life. Group therapy sessions. These sessions provide skills training, teaching patients how to respond to challenging situations and problems faced in day-to-day life. Phone calls. These operate as follow-up sessions in which the therapist checks in on the patient to discuss how successful they've been at applying the skills they've learned to life outside of therapy. Thanks to the implementation of skills training in mindfulness, acceptance, and tolerance of distress, DBT has been proven to be more effective in treating sufferers of borderline personality disorder than standard CBT. Speak to your doctor to help you find the right therapy method for you. Chapter 12. Getting help from your loved ones. As any sufferer of borderline personality disorder will know, one of the biggest challenges of BPD is relating to other people. BPD can make you feel alone, attacked, and unable to engage with those around you. You likely have a string of broken and damaged relationships behind you and don't see any hope of improving the way you connect with others. Sometimes you may want nothing more than to hide away from the world and have everyone forget you exist. But the reality is, the greater your support network, the more chance you have of defeating the disorder and going on to live a healthy and fulfilling life. Understanding the illness and the way it can manifest is the key for both you and those around you. It can be incredibly distressing for your loved ones to watch you struggle with the effects of BPD. It can cause them to feel helpless and full of anxiety. Then, of course, there are the effects of your acting out, which naturally have the greatest impact on those you care about. Witnessing a manifestation of BPD, such as aggression, self-harm, or even suicide attempts, can be terrifying for those around you. As BPD can cause you to act aggressively and hostile towards those closest to you, the disorder can be frightening and frustrating for your loved ones when they are placed on the receiving end of your attacks. Assisting them in understanding what to expect from the disease, along with what they can do to help them, go a long way to improving your relationship and ensuring you have the support you need. What your family needs to know to help you with BPD. Your family will often feel angry and helpless at how you relate to them. When you strike out at them, they may feel emotionally or even physically wounded and will have to fight their own urges to retaliate. But despite this, your family can be a great help and support when it comes to managing your BPD. After all, they love and are for you and want the best for you. Speak to your healthcare provider about involving your family in your treatment and management plan. Ask your healthcare provider to give you written information about the disorder for you to show your family. The more they understand about what you're going through, the more support they will be able to offer. When you begin treatment with a new psychologist or other healthcare professional, speak with your family members about which of them will be willing to be a part of your treatment. Ensure your psychologist is aware of which family members or even close friends they're able to speak with or contact with any concerns. Family psychoeducation sessions can also go a long way towards building a deeper understanding and easing the distress that comes with seeing a loved one battle with BPD. What your partner needs to know to help you with BPD. If you've been struggling with borderline personality for a number of years, you've likely seen the havoc it can wreak on romantic relationships. A BPD sufferer's intense fear of rejection, along with their inability to regulate their emotions, can lead to one drama-filled relationship after another. But BPD does not have to be a roadblock to having a successful relationship. There are many people with the disorder who have stable, loving, and supported families. The key lies in helping your partner understand what to expect and how your disorder may manifest itself. As with any relationship challenges, managing conflict becomes easier when you try to see the issue from your partner's point of view. This is especially important if you're suffering from a mental health disorder such as BPD, which can cause you to think in ways that your partner will not. To help them understand what you're going through, here are a few things it can be helpful to remind your partner of. It is important that they understand the way BPD sufferers are highly sensitive to rejection and abandonment, both real and perceived. Explain to them the way even mild separations, such as vacations or sudden changes in plans, can spark your negative emotions and distress, and the way having an important person disappear from your life, even for a short amount of time, can make you feel abandoned, lost, and worthless. Accept that these concepts, while they may make perfect sense to you, might be difficult for your partner to relate to. That's okay. The goal here is simply to help them to understand how these situations make you feel and react. As you know, the challenges of BPD mean you are easily drawn into arguments, conflict, and dramas. Ensure your partner understands the way your anger can creep up on you unaware. Help them understand that your BPD can make you very sensitive to the way you're treated. And this is never more prominent than in an intimate relationship. Ensure your partner understands that your heightened sensitivity and outbursts are caused by your disorder, not by something they may have done or not done. Explain to your partner the way BPD can heighten both positive and negative emotions. Tell them that even the smallest kind thing they do for you can cause you to react with intense joy and gratitude. But they must also be aware of the flip side of this, that even mild criticism a partner with BPD can result in intense anger and hurt. Help your partner understand your propensity towards black and white thinking. Explain to them the way it causes you to see things as either all good or all bad, and the way this can cause rapid fluctuations between love and admiration and intense dislike and disappointment. Explain to your partner the way BPD can cause you to misconstrue what others are saying to you. For this reason, it is important to make sure they know to communicate their meaning as effectively as possible. Explain to them the way you often have difficulty communicating through facial expressions alone. The unpredictability of being in a relationship with someone with BPD can cause your partner to have their own doubts about your relationship and their ability to handle it. Here are a few ways you and your partner can work together to make the management of BPD easier on both of you. Hold discussions only when you are both calm. As you are no doubt aware, when you're struggling with an episode of BPD, is no time for rational discussion. But be aware that your BPD outbursts can also cause intense emotional reactions from your partner as they struggle to deal with your behavior. If you have something important to discuss, ensure you are both calm and in control before you attempt to communicate. Get information. Help your partner find as much information as possible about what it is like to suffer from BPD. This will help increase empathy in the relationship and help your partner understand the struggles you face on a daily basis. Help your loved ones see that your challenging behavior is a facet of your illness rather than a choice. See a counselor. Seeking support from a mental health professional can be invaluable to both you and your partner. You may choose to attend therapy sessions alone or as a couple. Work on your communication. Communication is vital in any relationship, but when a partner suffers from BPD, it becomes even more vital that both parties are able to communicate effectively. Ensure that all discussions you have come from a place of love and do your best to understand that what you may perceive as hurtful behavior is simply your partner trying to do the best they can for the both of you. Tell your partner to avoid blaming everything on your mental illness. Help your partner to understand that your illness does not define you. Make sure they understand that not every aspect of who you are can be put down to BPD. Help them understand that doing so can cause the disorder to become something of a put-down. Ensure your partner is practicing self-care. Living with a partner with BPD can be an enormous challenge, and it is important that you acknowledge the immense struggles your loved one is going through. Ensure you give them time to themselves, and that they have a network of friends that they can rely on when things become overwhelming. As much as you might value your partner's support, accept that they need a life of their own. Allow them to prioritize time for friends and hobbies, both alone and with you. What your children need to know to help you with BPD. Being a parent is challenging at the best of times, and it can be an immense struggle when you're battling BPD symptoms as well. While all interpersonal relationships are challenged by borderline personality disorder, the relationship between a parent with BPD and their child can be one of the most difficult to navigate successfully. BPD can make it hard to be steady for your children, and it can feel near impossible to be a good parent. The sad reality is that many children with parents who suffer from BPD go on to exhibit attachment issues and other problems in adulthood. For this reason, it is crucial that parents with borderline personality disorder seek as much help as possible when raising their children. Parenting with BPD is something that should be managed in conjunction with your therapist and/or doctor, but here are a few ways you can make the challenge less insurmountable. Arrange a professional family support service to visit you and your child in your home. Attend individual therapy sessions to help you manage your feelings, especially those related to being a parent and your fears surrounding your child's upbringing. Attend group therapy with you and your child to help build your relationship. Parents with BPD can often be detached and distant, leading to attachment issues in their children. Therapy sessions can be crucial in countering this. Have someone else care for your child for a period of time. Either put your child in child care or another family member, allowing you to have a much-needed break. Just like when dealing with adults, helping your children to understand what you're going through can be of huge benefit when it comes to strengthening your relationship. Explain to them about your illness and exactly what it is you're going through, using books and stories where necessary. Teach your children about not only your own illness, but about mental health and well-being. This will help them understand your own erratic behavior and will also allow them to be more open about their own feelings and challenges. Engaging the help of a child psychologist can also be invaluable. If you have a baby, they should stay with you if you need to be admitted to hospital. The best thing you can do for your children is to work constantly on your treatment, doing your best to get well, along with shielding them as much as possible from the negative effects of BPD. Part 3. How to cope when your loved one has borderline personality disorder. Chapter 13. Managing a loved one with BPD. If you have a loved one who is suffering from borderline personality disorder, life can be full of aggression, fear, crises, and conflict. You might feel as though you're being held hostage with a barrage of demands made against you, terrified that your family member will injure or even kill themselves if you don't appease them. Perhaps they're acting violently or asking to borrow money or your car again. Maybe they're bombarding you with endless messages and voicemails. Dealing with BPD can be an ongoing and seemingly unrewarding challenge. Successfully dealing with borderline personality disorder requires you to build skills to de-escalating crises and building independence in your loved one. Although it can often seem impossible, with the right tools and strategies, it is possible to keep your loved one and make their way towards recovery. Understanding what your loved one is going through can help make BPD more manageable for both of you. When you appreciate just what it is your loved one is experiencing, it increases both empathy and your ability to foresee crises, allowing you to better manage them. So, what is it like to have BPD? Begin by accepting BPD for what it is, a severe limiting disability. As you're no doubt aware, it is a disability that can affect sufferers' quality of life on many levels, including their romantic relationships, friendships, and career prospects. The reality is that most people with BPD are severely unhappy. Thanks to the combination of chemical imbalances in the brain, along with deep-seated childhood traumas, a life with BPD is often one filled with great challenges. Beyond the mental symptoms themselves, BPD can also lead to broken education and few career options, drug and alcohol abuse, and loneliness. This is especially true for people on the lower end of the socioeconomic spectrum, as they usually have less access to treatment. Their hypersensitivity and tendency toward aggression can wreak havoc on every aspect of their lives. People with BPD are truly victims of their own illness. Sufferers of BPD describe the disorder as akin to being on a roller coaster, both in terms of the dramatic emotional highs and lows, but also in their constantly wavering sense of who they are. BPD can cause a person to have violent fluctuations in their self-image, goals and aspirations, and even their likes and dislikes. It can be confusing, disorienting, and frustrating. This feeling of being adrift can leave people with BPD frightened, in pain, and defensive. As you may already be aware, people with BPD can be extremely sensitive, with some people describing it as feeling like they are one giant exposed nerve. Seemingly small events or situations can trigger intense emotional reactions that are difficult to calm down. When in the midst of these intense emotions, BPD sufferers can find it hard to think straight. They may say hurtful things or act in reckless or dangerous ways, leading them to feel guilty or ashamed once the violent emotions have passed. But these damaging behaviors are rarely done with the intent to harm. Rather, they're done out of desperation. People with BPD are at risk of creating havoc in their own lives and the lives of those around them. Thanks to tendencies to misinterpret situations, they are quick to anger and often strike out at those closest to them, namely their family members, partners, or children. People with BPD, like any other illness, need to be treated with compassion and understanding, but it is also important to acknowledge that they need professional psychological help. Offer your loved one all the support and care you can, but do not try and manage on your own. Chapter 14. How to speak to someone with BPD. In general, people with BPD do not want special treatment. They just wish to be loved, an emotion which, thanks to traumatic upbringings, they may never have truly experienced. For BPDs, simple things such as maintain friendships or cohabiting may be enormous challenges. People with BPD exhibit heightened levels of sensitivity, meaning even the smallest criticism can cause great offense, leading them to behave with aggression and hostility. In addition, they're prone to misconstruing things that are said to them and taking offense when none was intended. These factors can make relating to someone with borderline personality disorder a complete minefield. While you want to treat your loved one the same way you would others, you must also be aware of the erratic behavior their disorder can cause. Here are a few ways to speak to and relate to a friend, partner, or family member suffering from BPD. What to do. Ensure your meaning is as clear as possible. Do not rely on subtleties or facial expressions to get your meaning across. Offer ongoing and regular support. Listen to them. Offer assistance and comfort when needed. Validate what they're going through. Acknowledge that while you may not be able to relate to their experience, you understand it is very real to them. If you understand the way they're feeling, tell them. But if their feelings do not make sense to you, try to find out more. Ask questions. Let them know you really want to understand. Encourage them to tell you more about the things they're feeling and why. Give them hope by acknowledging that other sufferers of BPD have gone on to live long and happy lives. Acknowledge that the person is suffering and help them break their goals down into small, manageable steps. Have realistic expectations. The nature of BPD means setbacks are commonplace. Do your best to remain positive and encourage the person to do the same. If it is appropriate, ask them about their BPD management plan and find out what role you can play in implementing this. Communicate your boundaries clearly. Tell them what you're not prepared to accept, be it abusive language, violence, threats, etc. If they're agitated, do your best to respond in a calm manner. If you feel in danger, remove yourself from the situation and call for help. Listening and reflecting on what you've been told is perhaps the most effective way of communicating with someone with BPD. Even though you may disagree with every word that comes out of your loved one's mouth, acknowledge that listening is not the same as agreeing to someone. You are simply accepting the person's emotions and perspective. Ask open-ended questions that encourages your loved one to share pieces of their life, such as, "Tell me what happened today to make you feel like this," or "How is your week going?" Summarizing back what you've been told. This helps someone with BPD feel heard and valued. For example, if your partner shares that she thinks you don't love her as much as you used to, you could say, "All right, you feel that I don't love you as much as I used to." Again, by doing this, you're not agreeing with the statement. You're simply acknowledging the emotions and perspective of the other person. Avoid the temptation to point out all the flaws in the argument. Remind yourself that the goal of this reflection is not necessarily to agree. It's not about proving who is right or wrong. It is about helping someone you love to feel valued and heard, and about de-escalating conflict before it transmutes into a crisis. Focus on emotions, not words. BPD sufferers are prone to speaking in ways that may come across as hurtful or antagonistic, and it can be difficult not to focus on these words. But rather than pulling your loved one up on something they may have said, look beneath their words to the core emotion belief. If you sense your loved one is struggling, ask questions such as, "It seems as though you're feeling hurt right now. Is that right?" Asking questions such as these will validate your loved one and their feelings and help them feel as though they're being heard. What not to do. Do not attempt to take control of the person's life. Allow them to make their own choices and simply offer your support. Do not let this become a source of conflict. Avoid being drawn into their conflicts with other people. As we will discuss further in Chapter 17, people with BPD are skilled at manipulating those around them to engage in conflict with each other. Do not be drawn into their attempts to do so. Do not try and talk them out of their feelings. A BPD sufferer might come to you with a claim like, "I'm a terrible person." Flat out disagreeing with this with a comment like, "You're not a terrible person," has the effect of invalidating their thoughts and feelings. Instead, try to understand what it is that has made them feel this way. Ask questions and listen carefully. Find out if there was something specific they did to make them feel like a terrible person. From there, engage in practical problem solving. Ask them what they can do to rectify the situation. Doing so gives the BPD sufferer a sense of being in control of their own lives and emotions. Do not attempt to be their therapist. Instead, assist your loved one in finding the right healthcare professional for them and offer your support throughout their treatment. Do not get defensive. While it can be challenging not to take accusations and criticisms personally, acknowledge that it is not about you. This is just a manifestation of the BPD. Remind yourself of this on a regular basis and do your best to see beyond the illness to the person you love beneath. How to communicate effectively during a crisis. When a loved one is in the midst of a BPD episode, they may become aggressive, insult you, or hurl out unfair accusations. As human, our natural response is to become defensive and counter their arguments with hostility and aggression of our own. But when dealing with a BPD sufferer, acting such a way will only exacerbate the situation. It's important to remember that someone with BPD finds it difficult to see things from someone else's perspective. They have difficulty telling the difference between a minor issue and a full-blown catastrophe. When you behave defensively, they see this as a sign that you're not valued. This will lead them to believe that you do not want to be around them, triggering their deep-seated fear of abandonment. This then leads them to act recklessly or in a self-harming manner. Instead, when your loved ones become reactive, take time to pay attention to what they're saying without pointing out the holes in their argument. While it is easier said than done, do your best not to take their attack personally. After all, it's not about you. If your loved one makes a point about something you did wrong, or something you could improve on in the future, acknowledge and accept their point. Make your apology, and attempt to discuss ways you can improve in the future. When someone with BPD feels as though they're being heard and taken seriously, the situation is less likely to get out of hand. If, however, the conflict increases to points of threats, aggression, or a tantrum, it will be most beneficial to walk away and attempt the conversation again when they have calmed down. How to identify an emergency. While disparaging self-talk is a common feature of borderline personality disorder, particularly among those suffering from quiet BPD, the sad reality is self-harming and suicide is all too common among people suffering from this disorder. When you are around a person with BPD, it is important to be vigilant and aware of any attempts at self-harming that may be taking place. When someone with BPD is reactive, it can easily escalate to the point where they will consider self-harming. It is important, however, not to plant the idea of self-injury or suicide in their head by outwardly asking them if they're considering it. Instead, provide a space where they can speak openly about what it is they are feeling or experiencing. This will then allow you to make a decision about whether to seek professional help on that occasion. Be aware that there are several subtle signs that may indicate a person is considering suicide or engaging in self-harm. These include shaving off their hair, isolating themselves from others, excessive scratching, or a reduced appetite. These less overt symptoms represent the BPD sufferer's inability to discuss their emotions outwardly. Being alert to these symptoms and seeking help accordingly can stop a crisis from escalating and requiring serious psychiatric or medical attention. All suicide and self-harming attempts should be taken seriously. Even if they're done to seek attention, they are still indicative of deep emotional trauma. While it is important to get your loved one professional assistance in any situation involving self-harm and suicide, seek help immediately if any of the following occurs. The person has deliberately injured themselves. The person is expressing suicidal thoughts or talking about killing someone else. The person is acting in an aggressive and abusive manner. The person has become disoriented, i.e., they do not know who they are, where they are, or what day it is. The person has become delusional or is having hallucinations. The person has become severely affected by drugs and or alcohol and is acting in a reckless manner. If you don't believe this situation has escalated to the point of being life-threatening, however, refraining from calling the emergency services. Doing so every time your loved one speaks of hurting themselves will signal to them that they have a great amount of power over you, and that by threatening to self-harm, they can effectively put an end to any conflict or argument. Instead, when your loved one speaks about self-harming, ask them what they would like to do about the situation. Suggest calling their therapist or an emergency hotline, or going together to the emergency room. Doing this gives the BPD sufferer back an element of control, which can assist in calming their runaway emotions. What to do when you feel overwhelmed? There's no doubting that having a loved one with BPD is a struggle. There are bound to be times when you feel overwhelmed and unable to cope. This is exacerbated by the fact that the person you love with BPD will generally be unable to fulfill the supportive role of parent, friend, or partner that they otherwise would. Because of this, it is crucial to have a strong network around you of people you can rely on in times of exhaustion, stress, and overwhelm. Allow yourself plenty of time to engage in hobbies and relaxation activities with friends who you can be open with. Ensure, too, that you have people you can speak openly to about the experience of living with someone with borderline personality disorder. This may be a therapist or other health professional, a support group, GP, or religious leader. Involving other people in your support and care of the BPD sufferer can also be invaluable. Caring for someone with a mental illness should never fall to one person alone. Ensure there are a number of people around you who are well versed in dealing with the individual with BPD and are able to act calmly and rationally in times of crisis. The more people around the BPD sufferer who know effective strategies for dealing with their reactivity, the less likely it is that a crisis will occur. Depending on the situation, your loved one's friends, siblings, parents, children, or extended family members are all people who can be turned to for support. Manage your expectations with regards to recovery. When dealing with a physical illness, recovery is often very black and white. But recovery is completely different when it comes to mental illness. Very rarely does recovery see the complete elimination of symptoms, and it is unlikely that someone suffering from a mental health disorder will ever be able to completely dispense with the need for therapy, medication, or other treatments. When dealing with borderline personality disorder, recovery can be measured in a number of ways. A sufferer in recovery will experience less frequent emotional outbursts, and these outbursts will decrease in intensity. There will be less incidences of self-harming and other impulsive, reckless behavior. While it is, of course, possible that there will be relapses, such crises will likely be resolved much more quickly than in the past. As their symptoms improve, your loved one will likely feel more and more confident taking steps towards living a full and successful life. Offering your support at every step of the journey will go a long way towards assisting this recovery. Chapter 15. Being in a relationship with someone with BPD. Often, people with BPD are very charismatic and energetic, so it is not difficult to be drawn to them. For this reason, many people find themselves in relationships with sufferers of borderline personality disorder. But the challenges of this illness mean a relationship with such a person is likely to be a cycle of perpetual arguments and dramas. But while conducting a relationship with someone with BPD can be a challenge, if you've found a partner whom you love and care for, the relationship is likely worth pursuing. The key lies in knowing what to expect and how your partner's disorder may manifest itself. Understanding your partner. To really understand what is going on inside your partner's head, ensure you have read part 1 of this book, a detailed overview of borderline personality disorder, its causes, and the ways it can manifest. But here are a few of the traits of BPD that can be most prominent within a romantic relationship. As people with BPD have such difficulty controlling their emotions, they often react with intense joy and gratitude if their partner does even the smallest kind thing for them. The flip side of this is that criticizing a partner with BPD can result in intense anger and hurt. As we've learned, people who suffer from BPD can be very sensitive to the way others treat them, and even the smallest criticism can cause them immense amounts of hurt. Sufferers of BPD will experience often violent mood swings, which can be difficult to anticipate. Recognize that this is a symptom of the disorder and likely not directly related to something you may or may not have done. Sufferers of BPD fear abandonment and rejection, and this is never more heightened than in a romantic relationship. Experiencing even the smallest amount of conflict can lead your partner to believe that you are about to leave them. Sometimes, in order to avoid this rejection, they will preemptively end the relationship in order to be the one to do the abandoning. Sufferers of BPD will have to work harder than normal to allow themselves to trust their partner and believe that they are not going to leave them. You've probably noticed your partner tends to pick fights with you when things seem to be going well. People with BPD have often grown up surrounded by such trauma that peace and harmony in a relationship is completely foreign. In order to regain a sense of normalcy, they will seek to uproot this security through aggression, hostility, and other damaging behavior. Peace and harmony can actually leave someone with BPD feeling empty and numb. In order to make themselves feel alive, they may attack you or create conflict in another way. This helps them feel something, which, in their eyes, is better than feeling empty. In addition, the BPD sufferer's propensity towards black and white thinking means they will often see you as either all good or all bad, often alternating rapidly between intense love and admiration to a crushing dislike and disappointment. How to cope. The unpredictability of being in a relationship with someone with BPD can cause you to have doubts of your own. It may feel as though the more you love your partner, the less they seem to love you. All this conflict and confusion may have you doubting whether you have the strength to maintain the relationship. These concerns can be heightened by the fact that you don't have your partner to rely on or confide in. This can leave you feeling lost and alone. Implementing the following solutions can make living with BPD much more manageable. Get information. Learn as much as you can about what it is like to suffer from BPD. This will help increase empathy in the relationship and help you understand the struggles faced by your partner on a daily basis. By familiarizing yourself with the traits of the disorder, it should become clear to you that your partner's challenging behavior is the result of an illness rather than a choice. See a counselor. Seeking support from a mental health professional can be invaluable to both sufferers of BPD and their loved ones. You may choose to attend therapy sessions alone or as a couple. Communicate. Communication is vital in any relationship, but when a partner suffers from BPD, learning how to effectively communicate is of utmost importance. It is crucial, however, that you take care not to say anything that your partner may perceive as a slight, or may make them feel unloved, or as though the relationship is about to end. Ensure that all discussions you have come from a place of love, rather than attacking your partner or seeking to put them down. Ensure your meaning is clear. BPD can cause sufferers to misconstrue what others are saying to them. For this reason, it's important to make sure you communicate your meaning as effectively as possible. Do not assume your facial expression is enough to convey what you are thinking. Hold discussions only when your partner is calm. Avoid raising important issues with your partner when they're suffering from an episode of BPD, such as exhibiting mood swings. When faced with decision-making in such a state, a BPD sufferer is likely to act rashly without thinking the issues through. They're also more likely to be defensive or aggressive and may turn to self-deprecating or self-harming behaviors in order to help them cope. Offer support. We all need support from our loved ones from time to time, and BPD sufferers are no different. Make sure your partner knows you're there for them, in good times and bad. Foster a sense of independence in your partner. As we know, BPD can lead a person to greatly fear rejection. Even the smallest of separations, such as a vacation or work trip, can be a source of immense stress. But these separations can be beneficial for fostering a sense of independence in your partner. Make sure you have parts of your lives that are independent from each other, your own hobbies, and circles of friends. While, of course, it is wonderful to have a partner with whom you can share so much of your life, having separate interests is great for your partner's sense of independence. If you're apart for longer than a few hours, it can be helpful to check in on your partner to ensure they understand that the separation is only temporary and that they are not being rejected. Avoid blaming everything on their mental illness. Remember that your partner's BPD does not define them. Avoid linking every part of their behavior to the BPD. After all, it's just one facet of who they are. Doing so can cause the disorder to become something of a put-down. See past the illness to your partner's personality and avoid labeling. Take threats of self-harm seriously. Threats of self-injury or suicide should always be taken seriously with a partner suffering from BPD. If your partner begins to exhibit signs of self-harming or suicidal behavior, call their therapist or your local suicide prevention helpline. See Chapter 14 for further information on how to act if your partner is exhibiting self-harming behavior. Practicing self-care. Living with a partner with BPD can be an enormous challenge. It's important to allow yourself time to step back and relax. Ensure you have your own support network in place, people you can rely on if the stress becomes overwhelming. Prioritize time for your friends and hobbies, both alone and with your partner. Chapter 16. Parenting a child with BPD. Raising children can be an enormous challenge at the best of times. Parenting a child with borderline personality disorder can seem like an insurmountable difficulty. While many of the techniques discussed in Chapter 13, 14, and 17 will be of great value to parents of BPD sufferers, here are a few important points when raising a child with BPD. Don't take it personally. While the onset of BPD can be linked to childhood trauma, it is important to acknowledge that this is not always the case. While an examination of your parenting styles can be beneficial, refrain from placing the blame for your child's conditions squarely on your own shoulders. Remember that you did and are doing the best you could do in the situation. Children with heightened emotional sensitivity take a special kind of parenting, and it can be an enormous challenge for parents to know how to respond effectively. Practice emotional intelligence. As a parent, it is easy to let your child's moods determine the way you yourself are feeling. Being emotionally codependent on your BPD child can lead to emotional burnout and distress. Foster your own emotional independence and work at growing your own tolerance to distress. You may find the self-soothing techniques described in Chapter 8 and 10 useful for not only your child, but for you as well. By building your own control over your emotions, you'll be able to show love and support for your child without letting your mood be influenced by his or her own. Have your whole family learn skills for managing BPD. The more people you and your children have around you that are able to successfully manage the symptoms of BPD, the smoother the management of the condition will be. Becoming well-versed in skills such as DBT can assist the whole family in providing as stable an upbringing as possible for your child. See past the stigma. While looking at your child's behavior through the label of BPD can help you understand their behavior, be aware that the disorder comes with a great deal of stigma attached. Look past the illness to your child's unique personality and acknowledge that the BPD is just a small facet of who they are. Separate their BPD symptoms from their personality traits and understand who they are beneath the illness. Have the whole family agree on boundaries. As we have discussed in Chapter 14, setting boundaries with regards to acceptable and unacceptable behavior is crucial for the successful management of BPD. When the situation involves a child, involve the whole family, especially the BPD sufferers themselves, in setting boundaries. Be sure to discuss the values behind the boundaries. Make sure everyone understands why certain limitations are in place. Agree on what the consequences will be if these boundaries are broken. It can help to even have a written contract which all parties sign. Doing this will help everybody feel more in control of the situation. Do, however, acknowledge that change can be difficult for everybody, particularly your BPD child. Do not attempt to implement all the boundaries at once. Rather, introduce them one at a time. Do not make empty threats. As parents, it can be easy to resort to empty threats such as, "If you don't eat your vegetables, there'll be no dessert." While these may have worked for young children, making such empty promises to older children and teenagers, especially those with BPD, are meaningless. Fully acknowledge the consequences discussed in your boundary setting session and follow through with implementing them if the boundaries are crossed. Chapter 17. Disarm those who are manipulating you. Reasoning with someone suffering from borderline personality disorder can be akin to reasoning with a child. Impossible. It can be enormously frustrating and difficult not to get drawn into the provocations of your partner, friend, or family member. But as you are no doubt aware, responding with hostility of your own is a surefire way to make the conflict escalate. In this chapter, we'll take a look at some of the techniques you can employ in order to disarm a BPD sufferer when they're acting with hostility towards you. These are crucial steps that can prevent your loved one's aggression from turning into a full-blown crisis. Firstly, acknowledge that, as someone in a relationship, of any sort with a person with BPD, you are, by default, part of the problem. Regardless of how well you handle your loved one's emotional outbursts, the very fact that you are there to respond and communicate with them means that you are part of the issue and also the solution. While you do not have the power to fix the individual with BPD, you can change your behavior towards them, in turn forcing them to change the way they behave towards you. People with BPD will attack you in order to get one of three reactions from you: guilt, helplessness, or hostility. As we've learned, people with BPD often grew up in a household full of conflict, so they seek to recreate such an environment in order to feel a sense of normalcy. If a person with BPD succeeds at getting one of these three reactions from you, they will keep up the same behavior in order to get the same reaction again and again. Failing to get the desired behavior will usually see a BPD become more harmonious. However, if they have received the desired reaction from this particular person at least once in the past, they will continue trying for a long time before they change their behavior. For this reason, it is vital to do your best not to reward the bad behavior of a BPD by exhibiting the reaction they are seeking. What not to do. Of course, it can be difficult to keep your cool and think clearly when faced with an emotional or physical attack from someone with BPD. The following steps can help you disarm your loved one before the conflict turns into a crisis. Do not make undue sacrifices. While you may well want to do everything in your power to help your loved one feel better, it's important not to do anything that is going to cause you to suffer in the long run. For example, do not stay up all night talking on the phone with them if you have work the next day. Do not lend them money you cannot afford, in the belief that they will have nowhere else to turn. Do not rearrange your entire schedule to fit in with their rapidly changing plans. Help your loved one by respecting your own needs. Do your best not to get defensive. While this is much easier said than done, avoid responding to their aggressive behavior with lines such as, "I'm only trying to help, you know." Do your best not to act hostile. While this again can seem like an impossible task, responding to BPD aggression with hostility of your own will only exacerbate the situation. If you feel your own rage beginning to surface, take a few deep breaths to calm yourself, count to 10, or remove yourself from the situation. Return to the conversation when you, and preferably also your loved one, are feeling calm. Do not allow yourself to feel guilty. When your loved one is assaulting you with a barrage of insults, it can be difficult to ignore their hurtful words. Acknowledge this is simply a manifestation of an illness. Do not allow yourself to feel responsible or guilty for them feeling a particular way. You cannot be expected to fix it or to resolve the impossible, unsolvable dilemmas brought about by the disorder. Do not lecture them. Sure, we all know drugs are harmful, or reckless driving can put the lives of many innocent people at risk, but arguing these points will have no effect on someone with BPD. Remember, reasoning with them can be like attempting to reason with a child. They will only respond in an argumentative way. Do not act superior. One of the major struggles for someone with BPD is that they are attempting to exist within a dysfunctional social network. While this is largely brought about by the disorder, of course, you yourself, along with everyone else in their sphere, constitutes part of this network. While this is not a cause for guilt or laying blame at your own feet, it is a reminder not to act superior or believe that you're any better than the person with BPD. Do not censor issues. If difficult issues such as suicide or violence arise, do not attempt to suppress them or change the subject. Instead, do your best to address them in a calm and rational way. Enlist the help of a therapist or counselor if you feel out of your depth. Do not attempt to deal with suicide attempts on your own. When someone with BPD is part of your life, you must be prepared for incidents of self-harm or even attempted suicide. If such an incident arises, it is important to get the person to a psychologist or other health professional as soon as possible. Do not attempt to deal with suicidal situations alone. See Chapter 14 for further information on dealing with emergencies. What to do? Understand and acknowledge their strengths. Though it may seem otherwise, many people with borderline personality disorder have a high level of interpersonal skills. This is evidenced by their ability to manipulate others and bring about the very emotional responses they are seeking. When attempting to disarm a BPD, be sure to acknowledge this strength. Understand that their reactions have likely come about through a childhood of being invalidated by their family, and so they carry the underlying belief that their job is to ensure everyone continues to undervalue them. Counter this by finding and acknowledging strengths in the person, such as their high level of interpersonal skills. Rather than looking at their behavior as a problem of someone with BPD, see that they are in fact very reasonable and expected responses for someone suffering from this disorder. Acknowledge that it is not a case of them being immature or deliberately malicious. Keep calm. If you do not agree with something a BPD is saying or doing, tell them so, but do it in a calm and restrained manner, even in the face of their hostility. Doing so without arguing about who is right or wrong. If you feel as though something you have said is being misinterpreted, a common occurrence when communicating with BPD sufferers, gently explain what you meant without focusing on the fact that the person with BPD misunderstood or made a mistake. Be honest. If you've done something wrong or made a mistake, be honest and admit it. However, do not, under any circumstances, admit to things you have not done just to pacify someone with BPD. While this may calm the storm for a brief period, it has the potential to lead to bigger issues in the future. Set boundaries. To handle the aggression and acting out of someone with BPD, it is important to set firm boundaries and stick to them. Be clear about what you will and will not tolerate with regards to language, aggression, and violence. If your loved one crosses a boundary, immediately remove yourself from the situation and refuse to engage with them any longer. Walking away when they engage in an unacceptable behavior will make the connection in their brain that behaving in this manner will result in them being left alone. Because of the BPD sufferer's intense fear of rejection, this action can have a great benefit when it comes to them learning what behavior is and isn't acceptable. Be sure your loved one understands both the boundaries you've set and the consequences of breaking them. Help them to appreciate that you walking away does not mean you don't love them, but rather that you will not tolerate emotional abuse. You can also let them know that if they ever feel emotionally threatened by you, they are welcome to do the same. Pay attention to your tone of voice. Regardless of what you're saying, If you're responding to a BPD sufferer with anxiety or nervousness in your voice, they will be aware of it. This will render anything you say to diffuse the situation ineffective. Practice speaking with a firm, matter-of-fact, and forthright tone. This both naturally boosts your confidence and removes a level of emotion from the confrontation. We often sound very different in reality to the way we perceive ourselves, so practice by recording yourself on your phone and listening back so you can hear exactly how you sound. Disagree rather than invalidate. As mentioned above, people suffering from BPD are often unconsciously inviting those around them to invalidate them. They often do this through making outlandish or wildly exaggerated statements. While it can be tempting to invalidate this statement by flat-out denying it, it is important to acknowledge that on almost every occasion, this statement contains at least a grain of truth. For example, someone with BPD might say to you, "Life is terrible." While your instinct may be to reassure this person that things are not that bad, recognize that for someone suffering from BPD, things most certainly can be that bad. So rather than invalidating their statement, acknowledge the truth of what they're saying, without accepting the exaggeration. For example, "It does sound like you've been having a difficult time lately," validates the truth within the statement while refusing to agree that life is always that bad. Accept that there are times you will feel helpless. The person with BPD may continue to make demand after demand on you to help them feel better, when the both of you know there's nothing you can do to improve the situation. In these cases, the BPD sufferer's goal is actually to make you feel helpless, and then make you feel anxious about your helplessness. To counter this, acknowledge that you are in fact helpless, but allow yourself to accept and be okay with this. For example, someone with BPD may come to you the night before an important exam and say, "I haven't studied and I don't know any of the material. I am definitely going to fail." In a situation like this, it is obvious that there is unlikely to be a positive outcome. You know that, and so does the person with BPD. If you attempt to come up with a solution, the BPD sufferer will likely see it as rubbish, and it will come across as though you're treating them as a fool. Instead, calmly respond along the lines of, "I wish there was something I could do to help," acknowledging the problem but accepting you are unable to assist with a solution. Remember, honesty is crucial when dealing with someone with BPD. Respond calmly to illogical statements. There will be many occasions on which a BPD sufferer will make arguments that seem absurd or illogical. For example, they may say something along the lines of, "I can't get by without cocaine." While to you this may seem like an untrue statement, resist the urge to argue your point outright. People with BPD are not stupid. They likely know just how damaging cocaine can be. However, there is likely more than a little truth to their claim that they cannot get by without it. Arguing flat out against these illogical statements does the job of invalidating the BPD sufferer, something we must seek to avoid. However, if you truly feel the need to discuss the matter with them, to do so by including a caveat such as, "I know you know this already, but..." Also, keep your statements short and to the point. Going into long-winded discussions about why cocaine is bad, for example, only serves to make the BPD sufferers look unintelligent. If they refuse to drop the subject or continue to argue, respond calmly with something like, "I disagree with you," or "I'm not going to insult your intelligence by arguing any more about this." Find the true meaning beneath hostile comments. People suffering from BPD can make comments which sound outward hostile or aggressive, but are often ambiguous. For example, they may ask bitterly, "Why do you always act like my mother?" While this can come across as a hostile comment, they may actually be making a comment on your caring nature. You can respond by simply acknowledging what they say to be true. For example, "Yes, I care about you very much." While it is ingrained in us to notice body language and tone of voice, in such a situation, it is beneficial to do the exact opposite and pay attention purely to the words being spoken. This will help you see past the hostility to the true meaning beneath. Be conscious of attempts at creating division. There have been many occasions in which people hospitalized for BPD have caused staff on the ward to argue over the best way to treat them. This is a situation often unconsciously engineered by the BPD sufferer, though the technique of mode flipping, i.e., behaving in a pitiable, meek manner to one person and hostile and aggressive to another. This will undoubtedly lead to disagreements in the best way to handle such an individual. Sufferers of BPD are also prone to engineering such situations among family and friendship groups. The best way to counter such a technique is to be aware of it. If you find yourself arguing with a family member about your loved one with BPD, acknowledge that the situation may have been set up by the BPD sufferer themselves. Ask the family member with whom you are arguing what they're basing their opinion on. Calmly present your own arguments, and then compare notes. Can you see any disparities or attempts by the BPD sufferer to create a division? From here, you can agree on the best way forward. Now you have all the information. In such a situation, however, it is important not to invalidate the BPD sufferer. For example, if they're trying to play you off against another family member, they may also make disparaging remarks about that person to you. If you stand up for this person and argue against what the BPD sufferer is saying, you are automatically invalidating them. If this situation arises, do your best not to respond emotionally and present any disagreements in a calm and respectful manner. Own up to your mistakes. Being around someone with BPD is an ongoing challenge, and there are bound to be times in which you behave in ways you did not intend to. You may find yourself acting aggressively or saying things you did not mean. If this happens, own up to your mistake. Wait until you're both calm and apologize for your behavior. But be sure to apologize only for the damaging thing you did or said, not for the negative emotions that led to it. For example, "I'm sorry I criticized you, but I felt as though you were automatically dismissing everything I said to you, without taking it into consideration." While apologizing can be difficult, exhibit a strong sense of integrity and responsibility. Be someone your loved one can look up to and to admire. Chapter 18. Breaking up with someone who has borderline personality disorder. As we've learned, people with BPD have a heightened sensitivity to rejection, whether real or imagined. And for this reason, breaking up with someone with BPD can be immensely difficult. When faced with abandonment, BPD sufferers can resort to impulsive, damaging behavior, self-injury, and even suicide. Because of this, there are many people who never leave their unhappy relationships with borderline partners, condemning both themselves and their partner to a life of unhappiness and conflict. Leaving someone with borderline personality disorder takes a lot of courage, but if you're unhappy in the relationship and you feel it has no future, it must be done. You cannot spend your life in an unhappy relationship and nor can you expect your partner to do the same. Here are some important things to take into consideration when ending a relationship with someone with BPD. Give yourself permission to end the relationship. For many people, this can be the biggest challenge. They do not want to be seen as someone who would deliberately hurt another, especially someone who faces so many other challenges in their day-to-day life. Breaking up with BPD sufferers can lead to their partners having intense feelings of guilt. There have been numerous cases in which people in relationships with BPD sufferers have seemingly willed themselves into illness and eventually death in order to leave the situation. But it is important to remember that it is your life. If you are anxious and unhappy in the relationship more than you're enjoying it, that is a sure sign that you need to get out. Give yourself permission to put yourself first. Be kind and succinct. When it comes to ending the relationship, endeavor to do so in a kind manner. Tell your partner calmly and clearly that you have appreciated your time together, but that it has now come to an end. Avoid going into detailed reasons about why the relationship is ending. There's no need to lay blame or point out all the reasons you're leaving. While doing so may ease your own guilt a little, it will likely exacerbate your partner's sense of loss and harm their fragile sense of self-worth. Allow yourself to mourn the loss. When leaving any relationship, no matter how damaging, it is normal to feel a sense of loss and emptiness. Acknowledge that this is okay, and give yourself permission to feel these emotions. Allow yourself to cry, to feel grief, to miss your partner. These are all normal experiences when a relationship is ending. You may have been led to believe that making the right decision results only in good feelings. Therefore, these negative emotions signal you've made the wrong choice. This, coupled with any guilt that may be arising, has the potential to have you questioning your decision. Remind yourself that you have made the decision that's best for yourself and stick to it. Set boundaries and stick to them. Once you've ended the relationship, it is in the BPD sufferer's nature to continue to call, text, or attempt to visit you for months or even years. This is due to their inability to accept rejection and their deep-seated fear of being alone. While this can be an immensely challenging period for you, the best thing you can do is not engage in any of their attempts at communication. Doing so will only prolong the pain of the situation for both of you. In an attempt to get your attention, your ex-partner may fluctuate between accusations and hurtful comments, and heartfelt expressions of love. Remember, for many people with BPD, there is no middle ground, only black and white, and they will do whatever they can to try and regain control and win you back. Naturally, refusing to respond to a BPD's attempts at communication can leave you guilt-ridden and fearful. You may worry your ex-partner will resort to self-harming or even attempt suicide, but accept that you cannot be held responsible for their behavior forever. You must begin to put yourself first. If you become fearful that your ex-partner may engage in behavior that is damaging to themselves or others, speak to their family members and/or therapist. Then remove yourself from the situation as soon as possible. Reclaim your belongings. The end of a relationship is something someone with BPD has a difficult time accepting. Because of this, they may seek to hang on to your belongings after the breakup in an attempt to keep hold of a piece of you. This is their way of not accepting that the relationship is truly over and of keeping the door open for far longer than you may wish. If you're considering leaving a relationship, it is a good idea to remove any stuff you have from your partner's home beforehand. This will remove the potential for any bitter conflicts that can arise when you try and reclaim your belongings, along with the chance of anything being destroyed in your partner's rage. Take care of yourself. Being in and ending a relationship with a BPD can have an immense effect on your own health and well-being. Living through months or years of emotional torment and manipulation can wear down your self-esteem, often leading you to believe the accusations flung at you by your ex-partner in the heat of the moment to be the truth. This constant emotional stress can have a very damaging effect on not only the psyche, but the physical body as well. Stress has been linked to countless illnesses, ranging from heart conditions to migraines to cancer. Allow yourself space and time to engage in self-care. Undertake relaxing activities such as yoga or meditation, and make time for your friends, interests, and hobbies. If you're struggling to get past your sense of guilt or loss once the relationship is ended, seeking the help of a therapist or counselor can have an enormous benefit. Examine your own attachment issues. Now you've managed to step away from a damaging relationship with a BPD, it may be a good time to examine your own issues regarding attachment and why you love the people you do. As we know, people with BPD need conflict in their relationship to create a sense of normalcy and stave off feelings of emptiness. But it is also worth asking yourself, what drew you to your BPD partner in the first place? Was it their charisma and energy? Or are you yourself carrying attachment issues that led you to seek out a potentially damaging relationship? As people with BPD generally have a strong desire for both physical and emotional intimacy, they often tend towards insecure attachment styles that can lead to damaging relationships. When they find themselves in romantic relationships, sufferers of BPD often experience chronic stress, abuse at the hands of their partners, and unwanted pregnancies. Ask yourself whether your relationship with a BPD sufferer was a damaging one for both of you. If so, what role did you play? We learn who to love and how to love from our parents and upbringing. If you grew up with parents who are absent or abusive in any way, these issues may have manifested themselves in an insecure attachment style, leading you to seek out relationships with people who will have a negative effect on you. In all likelihood, both you and your ex-partner have suffered trauma in your childhood, leading you both to form your relationship. Perhaps as a child you were neglected by your parents, leading you to become a people pleaser. You may have learned that the only way to gain attention and praise was to behave in a perfect manner and suppress any negative emotions, as doing so may have antagonized emotionally or physically abusive parents. People pleasers are often drawn to BPDs because they represent your shadow side, that part of your being that you suppress and prevent from seeing the light of day. Namely, your negative emotions such as anger, fear, and jealousy. A person with BPD has no difficulty expressing these emotions, and by pairing yourself with them, you are allowing yourself to become whole. Or perhaps like your partner, you grew up in a household of chaos and conflict, and by seeking out a relationship with a BPD sufferer, you're simply recreating the tumultuous environment which feels most natural to you. Working with a counselor or therapist can help you identify and remove your own attachment issues. By recognizing exactly what drew you towards your ex-partner in the first place, you can address these issues and save yourself the pain of repeating the pattern in future relationships. Conclusion. While borderline personality disorder has the potential to wreak havoc on both sufferers and their loved ones, it is important to acknowledge that there is hope. Hopefully, this book has shown you that just as there are many different degrees of BPD, there are also many ways of tackling the disorder. By working on their own emotional management techniques, and in conjunction with their therapist and loved ones, BPD sufferers have the potential to greatly improve their symptoms and go on to live their lives to the fullest. While the road to recovery is bound to be a challenging one, vast improvement is possible. There are many people with BPD who go on to live long, productive, and happy lives, holding down steady jobs, meaningful relationships, and loving families. There's no reason you or your loved one cannot do the same. This has been Borderline Personality Disorder, the hidden faces of BPD that you need to spot. How to manage out-of-control emotions before they destroy your relationship. Written by David Lawson, Ph.D. Narrated by Russell Newton. Copyright 2020 by David Lawson, Ph.D. Production copyright by David Lawson, Ph.D.
Audible hopes you have enjoyed this program.